Dr. Sendil, you can switch on the mic and speak. Good evening.
Sujan, ready ಆಯ್ತಾ? ఇక్కడ మ్యూట్ కావాలంటే మ్యూట్ అంతే. ఎయిర్ పాడ్స్ వస్తున్నాయి కరెక్ట్ ఏం చేసేది ఏట్లేదు ఆల్రెడీ మీటింగ్ స్టార్ట్ అయితే వచ్చేస్తుంది దాంతో మాట్లాడాల్చుకుంటే హలో అని
మరి నాకు ఇంట్రెస్ట్
స్టార్ట్ చేయలేదు కదా.
Good evening, Dr. Satyajit.
Good evening. Good evening. How are you? How are
Fine.
you? Yeah, okay.
I'm good. I'm good.
Thank you. So,
Hari, Hari, Saravanan. Good evening.
Good evening, sir. Good evening, sir.
Nanbu,
Sir.
Raman.
Good evening.
Sir, good evening, sir.
Sir,
Good
sir.
evening.
Good evening.
Evaluation, sir. Good evening.
Good evening.
Good evening, sir. Good evening.
Dean, sir. Sajid
good
Bora, sir.
evening.
Good evening,
Good
sir.
evening, sir. Good evening.
Saravanan, sir. Good evening.
Good evening. Good evening, sir.
Ravi Mohan, sir.
Good evening, sir. Good evening.
Jayaraman, sir. Sadanandan, sir.
Sendil, how many numbers
Sir,
in
yes, sir.
Zoom connection? இப்போ எவ்வளவு பேர் இருக்காங்க?
150, sir.
150.
Gunasekharan,
There are a
sir.
lot of there are a lot of waitings. நம்ம எல்லாத்தையும் இன் பண்ணிடலாமா?
Yes, sir.
Admit
I'm
பண்ணலாமா?
just.
Kunasekaran, sir. Good evening.
Waiting room disable பண்ணிக்கிறேன்.
I think we can start. Dr. Santil Kumar. Dr. Santil, I think we can start. It is already 6 o'clock.
Sir. Sir.
Yeah.
But we'll check with our national president, sir.
National President, sir, is not joining. We have not received any reply from SSG
Yes,
also.
told it. Yes, told it. So you talk to him, sir.
Actually, he's on a meeting in Pune, so he's too occupied, he said. Our Finance Secretary, Sitish Bali, will be joining, and SSG probably will be joining.
Now, after the welcome, they have to address, no, just will within 2 minutes, we'll start, sir.
Yeah.
Sir, you'll be joining the program, sir. World Defense Day. Okay, thank you, sir.
யாரு?
Sir, Dean, sir, our national president and national HSG, they will join when they can. They said, so we'll start the program, sir. It is exactly.
And so our Vice President Gunasekaran sir is there.
The Vice President sir is joining, sir. Just a few minutes
Okay.
will wait, sir. That's it.
Okay. Dr. Gunasekaran sir is here. He will be on behalf of the national president. He will do that. Okay. Sandil sir will start the program, sir.
Yes, sir. Just a minute, sir.
செந்தில்
Yes, sir. Sir, good evening, sir.
We'll start.
நான் இருக்கேன்பா ரெடியா இருக்கேன்
Yes, sir. Yes, sir. We will start the.
Okay. Indian Medical Association College of General Practitioners Headquarters. Today we are observing the World Health Day on the theme of My Health, My Rights. So this program is
Yes, sir.
organized by IMA CGP wing. So I request the chairman of IMA CGP Tamil Nadu, Dr. Sandil Kumar, to master the program and will conduct the inaugural program first and then the CME program. Dr. Sandil Kumar. Dr. Sandil Kumar.
Yes, just a minute.
Dr. Sitish Bali sir has joined. Good evening, sir.
Good evening, sir.
Good evening.
Sujit Bali sir, welcome, sir.
Namaskar, sir. How are you?
Doing well, sir. Sir, Sandil Kumar, you can start the programs.
Yes, sir. Just a minute, sir. Just a minute.
Sandil Kumar, your audio is not here.
Yes, sir.
Your audio-
Sir, now I request Dr. Derimi Mohan sir to say IMA prayer.
Dr. Derami Mohan. Sir, unmute and tell.
Hello, good evening all.
Yes.
IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you.
Now the physician's prayer by Dr. T. Ananda Chokalingam, Secretary CGP IMA TNSB.
Sir, can you hear me, sir? Good evening, sir.
Sir, please to continue, sir.
Sir, can you hear me, sir?
Yes, yes.
Sir, you are audible, sir. You continue, sir, with the physician prayer.
Dear Lord, 1 minute, sir. Dear Lord, thou great physician, I kneel before thee, since every good and perfect gift must come from thee. I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart, give singleness of purpose, strength of life, at least a part of the burden of my suffering fellow men, and a true realization of rare privilege that is mine. Take from my heart all guile and worldliness. That is with the simple faith of a child I rely on thee. Thank you, sir.
Thank you, Dr. Ananda Chukalingam.
Yeah, so now I'm in, sir. Yes, sir. Sir, thank you, sir. Now I request our CGP headquarters Dean Dr. Satyajit Bora, sir, to give his welcome address on this special occasion.
Thank you. Respected IMA National Vice President, Dr. Kunasekaran sir, Honorary Finance Secretary, Dr. Sitish Bali, past national presidents and our patrons, I think they have not joined till now, Dr. Jayanal and Dr. Arulra sir, Tamil Nadu IMA State President, Dr. K. Abul Hassan, other leaders who are joining in this platform, and I welcome you all, including the participants. We can see a lot of 382 participants joining. Also the faculty of today's meeting, Dr. Manikaran, Dr. Arun Kumar, Dr. Jacob, Dr. Ekambaram, and Mr. Prem Kumar. I welcome all of you to this virtual platform of Indian Medical Association College of General Practitioners, and a very warm good evening to everyone. The World Health Organization has chosen My Health, My Right as the theme of World Health Day 2024. Throughout the globe, the right to health of millions is increasingly coming under threat. Though many countries, including India, recognizes health as the human right in the constitution, yet these countries yet lack any sincere effort in practice to ensure and empower the populations with their full right for a sound health. Air pollution is increasing, causing climate crisis and taking our right to breathe clean air, resulting respiratory diseases and death. Wars and conflicts are causing health issues, hunger, and psychological distress, including death. Basic health needs like drinking water and sanitation are grave public health concerns even in today's India. Indian Medical Association in its Health Manifesto 2024 has rightly asked for an universal healthcare as the basic health package for its citizens. And it is in the line of today's theme, My Health, My Right. IMA CGP is proud to be associated with organizing a virtual meeting on this World Health Day. And I have a strong belief that today's deliberations and discussions by these panelists here will be enriching our knowledge and our insight into the cause of health for the citizens. My greetings to all of you once again and welcome. Thank you.
Thank you, sir. Now I request our Senior National Vice President, Dr. Gunasegaran sir, to give his address on behalf of our National President, Dr. R.V. Ashokan sir.
Good evening, sir. Good evening, everyone. Respected the Dean of Studies of IMA CGP, Dr. Satyajit Bora, our Honorable Finance Secretary, Dr. Sitish Bali, the CGP Secretary Headquarters, Dr. Anburajan, our State President, Dr. Abul Hassan, Tamil Nadu State President, Secretary, Dr. Karthik Prabhu, and the Joint Secretary of CGP, Dr. Sendil Kumar, Lidhi Sendil Kumar, who organized this program in a very good manner, and Dr. Anand and other office bearers of IMA CGP, and all the past national presidents and past leaders and other colleagues of IMA. It is a very proud and delighted moment and fitting manner we are organizing the World Health Day today. And also the topic for the day is nutrition and fitness, which will be very much useful for not only for the members of our profession, but also for the entire country and the population. Especially the fitness is very important, starting from the schooling, education, and later on for the work they perform, and also for the community activities, and whatever profession they take, they need a good fitness. for getting fitness, we need a very good nutrition. Without nutrition, fitness will not occur, will not go hand in hand. So nowadays, lot of food materials are available wherever we go. In that, which food we have to select, how we have to have our fitness in a correct manner, and how much calories, whether we have to take it in the form of calories or for the taste or for our filling of the stomach. Our learned speakers are there today to explain in detail about the nutrition and fitness. We are very much eager to hear the thing, not only for me and also for our professional members and also the general public. Many of them are joined now, almost nearing 450 members are joined. Many are seeing the YouTube also. I congratulate the IMA CGP headquarters office, especially Dr. Anburajan, Dr. Satyajit Bora, Dr. D. Senthil Kumar, and all the office bearers for conducting this wonderful program. Thank you very much. Wish you all the best.
Thank you so much, sir, for your inspirational talk. And now I request our Honorary Finance Secretary, Dr. Sitich Bali, sir, to give his address. Sir, are you on?
Bali, sir? Dr. Senthil, you can move on to the next person. Then
Yes,
we'll
sir.
call
Yeah,
you.
I think, am I audible now?
Yes, sir. Yes, sir. You are audible, sir. You can
Right,
continue.
right. So it's a
please,
good evening from my side from Delhi. So I would like to thank Dr. Gunasekaran, sir, our National Senior Vice President, Dr. Satyajit Bora, Dean CGP IMA Headquarters, Dr. Amburajan, Secretary IMA CGP, Dr. Jai Jailal, our past National President, who would be giving a talk here, Dr. Abul Hassan, the President of IMA Tamil Nadu State, Dr. Kartik Prabhu, the Secretary of IMA Tamil Nadu State. And I would like to congratulate CGP on coming out with a very nice topic about health. We all know that health is wealth, but somehow, because of professional commitments, for studies and for earning money and from having a professional life, we somehow lose down on the health part and realize it. We are already having a plenty of disease, for example, like hypertension, stress, which is quite common nowadays, especially in doctors. We start losing the wealth to try and gain the health. Other thing important here is, in case you have any chronic disease, we should be, prepared to live healthy with that, accept it and go on in life. But what is more important about health, what is being covered now and today nicely, is going to be nutrition. Nutrition plays a vital and a pivotal role nowadays in health, especially with such a lot of impurities happening, such a lot of wrong things happening in the world. We are somehow lacking the pure food which should be there, which was initially there, because of which plenty of diseases are happening and rampant here. We have, actually adapted the Western diet, which is not good. Traditional diet of the Indian food was really good. So we had incidence of diabetes, hypertension, CKD, and everything was less in our ancestors as compared to today. I'm more than happy that today all this factor is going to be covered. I'm damn sure that all those members who are attending this would definitely take a message back home and try and incorporate whatever is discussed today. So with these words, I thank the organizers to invite me and give a small presentation. Thank you. All the best.
So thank you, sir. So now I request our Professor Dr. J. A. Jailal, sir, Secretary, Commonwealth Medical Association and past National President, to give the keynote address for this important and special occasion. Jailal, sir, please, sir. Yes.
Am I audible?
Yes, sir. Now audible, sir.
So thank you very much, Siddhil, and beloved and distinguished leaders of Indian Medical Association. And first of all, on behalf of the Indian Medical Association and the Commonwealth Medical Association, I extend you all a warm greetings on this World Health Day. This is indeed a very
Your volume is
Sir,
little
your
low.
volume is low, sir.
Increase the volume. Yes.
Volume is low.
Hello? Hello?
Yes, sir. So slightly the volume is low, sir.
Is it still it is slow?
Sir, slightly better, sir. Yes, sir. Fine, sir.
So it is indeed why that is what is slow.
Sir, it's not audible, sir.
Right, he has gone out.
So now just
With the
meanwhile, yes, sir. Now, so before sir enters in, just we will finish with yes, sir. Yes, sir.
Is it audible now, sir?
Excellent, sir. Yes, sir. Yes, sir.
So thank you. I'm extremely happy and delighted to be with you at this moment. And on behalf of the Indian Medical Association and the Commonwealth Medical Association, I extend the warm greetings on this World Health Day. I'm so happy that today the Indian Medical Association, especially the College of General Practitioners, has taken this topic to reach out to the public, saying that it's my health and my right. It has been a fundamental, health as a fundamental right, to establish it as a fundamental right. Indian Medical Association, especially College of General Practitioners, is making it as a big demand or big fight for a long, long period of time. We also know ever since in 1948, when the universal fundamental right was formed with the UNESCO and with the help of the World Health Organization in 1948, the Article 25 of that universal fundamental right, it envisioned health as a fundamental right, and India was also one of the signatories. Even in 1946, when the WHO was announcing that is out of the fundamental right, health was included. But unfortunately, in our constitution, which talks about mainly in Article 21, which talks about the fundamental right to live and the prosperity life, but not essentially or exclusively or explicitly, it is telling health as a fundamental right. But subsequently, when we are talking about the part 4th of a constitution, which talks about the direct role of the state to DSPP, in various sections, the section article 32, 37, 42, 47, all this talks about the state as a right to establish the health of this. But as on date, we cannot say, except in the state of Rajasthan, no state nor the center has passed a law very categorically saying health as a fundamental right. Today, as we are talking about this health as a fundamental right, the whole of the world, 140 countries has already passed this law. And in whole of the world, 140 countries, health is a fundamental right. Though India has circumferentially talking about that, we do not have explicit statement. Even some of the court judgments, whether it is the Kerala versus the Central Court judgment or the Supreme Court judgment, all talks about that. It needs to be included, but there is no parliament provision for that. And why it is not there, and what is the significance of that? If it is a health as a fundamental right, and it will have a lot of impact, because today the lot of anomalies which is taking place in the whole world, whole of India, it's one of the solutions that we need to make the health as a fundamental right. I just want to briefly take about the 5 components of this. One is a safe healthcare delivery, that today majority of our population are not able to reach out, we get the safe, quality-oriented healthcare delivery from the public health infrastructure, public health institution. Yes, average healthcare we are able to give, but we are not able to ensure, we are not able to say the quality and standard protocol care throughout the country and throughout the nook and corners the people are getting. And once we are making it as a health as a fundamental right, it has become our responsibility to ensure that the fundamental right of the health, they are able to get into that. The most significant that to ensure that we need the government to spend the healthcare infrastructure spending needs to be improved. That's all we all know. The GDP which the government is spending is very, very small and very, very less than 2.1 or 2 around GDP. But the WHO all say, the World Health Organization and almost all the monetary organizations are saying minimum 5% of the GDP has to be spent on that. So the first component is you are talking about the safe and quality healthcare. It is a component of the fundamental right. This is a statement from the WHO. The second most component of the health as a fundamental right is the privacy and confidentiality to the your health data. And whatever your data, whatever they construct, you have the privacy and the confidentiality. As on date today, and the data which we are giving to the government hospital or the data we are giving to the most of the private hospital, the confidentiality part or the security part, privacy part is lost, especially today with the government of India trying to bring in ABBA system. That is, every hospital needs to upload the discharge summary in the system. But we do not have a guarantee that who is going to maintain that, who is going to take care of that. So this is again another area where we need to look on and how the confidentiality there. The third component of the fundamental right health assistance, as the WHO is saying, the information about your treatment, the procedures available, the outcome of this, and the consent which you are going to get. And this is one of the contradictory view which we are going to face in India. If India, the health is made of fundamental right, the secret remedial act, which the most of the other system of medicine is following, that says that what is this medicine contain and how it is active, we need not tell. That is a secret medicine act. There is some other system of medicines will find it extremely difficult to say the third component of the fundamental right, because all the details of the treatment, all the details, components of the treatment, and outcome of the treatment, and it has to be put to the patient, and the patient should get the consent for that. And this is one area the government is now afraid to make, as per the WHO definition or as per the Supreme Court direction, the health to become a fundamental right. And if that is made, today the fake people, the people who are making so much of claim that I will cure this, I will make this, is not be able to be possible. It will be automatically, there needs to be a control. So this is another area where we need to raise our voice to ensure that the health is a fundamental right. The fourth component is a bodily autonomy and the integrity. And this is a little tricky word which the WHO is using, the body autonomy. Today, especially when we talk about the India, as we are going to talk about the nutrition today, who is going to decide about what food you eat? Who is going to decide about what kind of dress you are going to put for your body? Who is going to decide about what kind of sexual behavior you are going to give? And are we giving an autonomy to the patient? Are we giving the right, an individual right to the choice of the person that he has to take the bodily autonomy? Whatever you need to do about your body, whatever you need to achieve through the body, whatever you need to get through your body, it is to be your choice. And nobody can compel you that what you need to eat. We can only empower the patient to say that this is a good, this is what you can eat. But the decision of taking that is the most important thing for the patient to take the decision. That is the word which we talk normally about the bodily integrity, bodily autonomy and integrity. That finally, the most important component of the fundamental right, the right to choose a doctor, right to choose the hospital, right to choose a system of medicine, right to choose and what he needs to get has to be the decision of the patient, decision of the sufferer. And unfortunately, what is happening? The insurance sectors are going to decide where to go. The insurance sectors are going to say that which doctor you are going to see, whether it is an Ayushman Bharat, whether it is a CMCHS scheme, and they are not giving the liberty to the patient to take their doctor, right to the patient to choose their hospital, right to patient to choose them. So these five are the components of when we talk about my health, my right. And this is a struggle which Indian Medical Association, especially our College of General Practitioners, repeatedly write into the ministry, repeatedly write to the government, inclusive all these five components as a fundamental right of the health, and bring this as a law, bring this as an amendment to the Article 25, 21, which takes the right to live. Not we are talking about right to live with good health, right to give with the health. The state should take the responsibility. Even the Right to Health Act, which is brought to by the Rajasthan, they say the emergency, the patient can have the right to health. But who is going to take care of the expenses involved? They are putting the blame on the hospital and the doctors. The government is not coming forward to take the responsibility to provide emergency health care. They say that it is a responsibility of the hospital. That is where the conflict is coming. So including all that, safe and quality healthcare delivery to the patient and provision of confidentiality and the privacy to the data which is provided, and also with the informed consent to get with all the data with related to the healthcare the patient should be able to get bodily autonomy and integrity. And the fifth component is the right to choose their treatment modality. So today, as we talk about this dream, that is why the WHO has today given the theme, it is my health is my right. My health is my right. And today education has become a right, but not the health. So we, as on this day, I think I request the IMA CGP once again write to the government the importance of making right health as a fundamental right, and making sure as the WHO is giving an open call today, and already 140 countries has taken up. India should be also a part of it, and India should also initiate steps to make sure that health is becoming a fundamental right. Let this be not a day slogan. Let this be a slogan for this whole year. This is the whole year, all your activities which you are planning, all the things which you are going to talk, all the things which we are going to discuss shall reflect our view that the health shall be the fundamental right of the individual. The nutrition and the everything, the information about this should reach them. The people should be empowered to the decision. The healthcare spending should be increased, and more so. Finally, health is not a mere absence of disease. But the Supreme Court is also agreeing that in the recent judgment also they mentioned that health is not a mere absence. But what is more important, safe environment. You have a air quality index. Today, the India stands in the very difficult air quality index. The air quality index in the Delhi is reaching to the purple level. That means it is the most dangerous level it is reaching. Similarly, the water, the environmental, the protected water in the Bangalore, the city where we are facing that people are suffering with getting water for drinking. And Chennai is not far. And any district, any state cannot say that we are far from this water crisis. And when we talk the health as a fundamental right, it also includes my freedom to breathe air free from pollution, the freedom to have water, which is freedom from the all the infectious. So that is a dream. It's a challenge to every doctor of Indian Medical Association. It's a challenge to every one of you who are listening to that. It is not a mere word to say that when we talk about the health as a fundamental right, health is my right. But are we having the right to have the good air, good water, good health, good hospital, and nobody is compelling you to what you do? You are giving an autonomy, and if that can be achieved, and that is the great dream of Indian Medical Association, I'm sure and confident the leaders of IMA CGP, especially the people who are now heading, will put more thought on this, more content, more competition among the JDN. I am so happy the JDN and the paramedical people are here. It is not the doctors alone. The JDN and the MSN should infuse this idea, and you should conduct a program exclusively for the JDN. So they should think about that. And we talk about health as a my right, and what component, what I can do, what are the steps we will be involved, and let us go forward and reach a targetable or achievable level of health, not only for health for all, but the quality, accessible, affordable, quality-oriented, safe healthcare to all to reach. Thank you very much for this opportunity to share on the theme of the World Health Day, that is my health is my right.
Thank you so much, sir. Thank you, sir, for your sparkling talk, and really you are the inspiration to include even our doctors, our family, paramedical students, MSN, JDN, and even NGOs like Rotary Lines, and even general public and even children are watching this program, sir. Thank you, sir. So we will cater the program to all kind of people and make it very interesting one. Thank you so much, sir. Thanks.
Thank you.
Thanks. Sir, now may I call upon Dr. Abul Hassan, sir, President, IMA Tamil Nadu, to give his felicitations.
Thank you, Sandil. Respected Dr. Jailal, Commonwealth Secretary, and our Vice President, Dr. Gunasekharan, Dean, Dr. Satyajit Bora, and all the galaxy of leaders of CGP and IMA, and also the delegates who are gathered here. As Sendil Kumar said, this program is very unique in the sense that not only medicos, there are other non-medicos who are interested and will be appreciated. This program also joined. I am very happy today. There are faculties like Paul Manikam, Arun Kumar, Santosh Jacob, Santosh Prem Kumar, all joined to discuss about the nutrition. This World Health Day is observed every year from 1950 with the objective of reaffirming our commitment to healthier future. They have termed, as Jailal elaborated it, the theme, the My Health, My Right. That also says us my health, my right means my right to quality healthcare, my right to have safe drinking water, my right to have breathe clean air and good nutrition, good housing. These things tell us that not only the government and every one of you gathered here should play a role in achieving all these rights. Today we know that the water, if it is polluted, linked to various diseases like cancer, etc., etc. If the air is polluted, it is linked to diseases like hypertension, diabetes, other diseases. So I think we all have to work very hard to have a healthy future. If these things are fixed, if health is fixed, health for all is fixed, then the other things, other inequalities are there in our country like poverty and illiteracy. So these things to be fixed. To fix poverty and illiteracy, health is a fundamental thing. That's why we at WHO emphasize this thing, the health, my health, my right, my right. IMA Tamil Nadu State Branch has formed committees, namely 2 committees in this direction. One is committee for climate change, another is committee for wellness and lifestyle modification. These committees are doing excellently well, and end of the year we are going to draft resolutions in these 2 spheres of life and sending it to the government. So I once again reiterate and also reemphasize that every citizen of this country should play a major role in getting every citizen a quality health service and quality drinking water, clean air, good nutrition, and quality housing. We pick up one that is a good nutrition today, and we are going to discuss various aspects of nutrition, which is good, which is not good. We have so many stalwarts, and they are going to tell us that the way of eating, time of eating, and what is good for eating. All these things, I think it will be mixed with lots of good messages to all the delegates who are gathered here. So I once again thank organizers IMA CGP for organizing this wonderful seminar for not only medicals but also other people in the society, and also thank the faculties for accepting our offer from IMA and taking part in this very unique event. Thank you very much for the opportunity. Over to you, Dr. Sendil Kumar.
Thank you, sir. Now I request Professor Dr. Arul Raj, sir, past national president, to give his felicitations.
Good evening, Sendil, and the office bearers and the participants on this World Health Day communication on behalf of IMA College of General Practitioners.
So IMA CGP is the, foundation stone for family doctors, which is a great concept, which was, founded in India and spread throughout the world. But now going to the back, people are now choosing to go to, super specialists. And I am happy this World Health Day that, has given a very excellent concept or a theme, my health, my rights. Why this is very excellent means, see, it says to have your health is your right. Your right always comes from a constitution. In India, we have a right to education. In India, we have a right to have water and food, but we don't have a right to have health. You have a right to have life, but not a right to have, health, which we have been stressing for nearly, 2 decades, and so far nothing has come. The first thing that has come out is from Rajasthan, the Right to Health Act has come. Now, what does this theme, mean? You have a right for your health through constitution. Number 2 is your choice. You yourself can always decide. I used to always say that the government does its best, fine, but we can also choose to have our own health. And how to choose, you should know the various habits that we do, that we call that as lifestyles, either the eating habits or the physical activity or your various smoking and other habits and your sleeps, yoga, meditation, all those things form the lifestyle. When you take a positive lifestyle measures, your health is retained and becomes your own responsibility. We will push at one end. With IMA also, we are going to push. We will continue to push to get health as a constitutional right. One of the major parties in this election has given that they will make health as a fundamental right for the citizen. Very good. But in the meantime, we have our own obligation to choose our rights. Therefore, on this occasion, I congratulate our IMA college. It has chosen an important component of right to health, that is nutrition. And the nutrition and fitness. See, always in this era today, busy era, nobody is there to look after anybody. You will have to look after, your own self. At this stage, you should keep yourself fit, where the nutrition plays a very important role. I used to always say, how much of rice you are going to eat? And we always think that rice is the important food for us, rice. No, there are many things that are important on the health side of it. The quantity of rice or food, the quality of food, when do you take it, how much you take it, all should be discussed. I am confident we have an elegant team to discuss about it. I'm so happy and appreciate our CGP for involving the NGOs and public in this, activity, because this is not only for doctors. Health is a right for every citizen of this great nation. And they have, involved the major citizens. I am sure this particular communication on nutrition and, fitness will definitely pass on a clear message on this World Health Day to the citizen of India, and see that they maintain their own health and India becomes a healthy nation. I used to always say, healthy nation is a developed nation. When you see the developed nations, health is the primary thing there. In India, it has to. When India becomes a healthy India, it will become a developed India. That is the vision of our Honorable PMG, as well as every citizen. I am sure this is a great move towards a healthy India, which is a developed India. My best wishes. Thank you. Thank you all.
Thank you so much, sir. Now I request our Secretary, Tamil Nadu IMA Secretary, Dr. Karthik Prabhu sir, to give his felicitations.
Thank you, Sundar sir. Respected leaders of IMA, national and state, IMA and CGP, good evening, everybody. Sir, I won't take much time because the speakers, wonderful panel. I'm also very happy that Santosh Jacob is my very dear friend and my batchmate in Ramchandra Medical College. So I really congratulate all the speakers because all are great YouTubers with good following, wonderful topic, carefully chosen. Fine, it's all nice, sir. Coming to the health day we were all talking about the fundamental right. Yes, health is a fundamental right and everything has been spoken. I would like to just add one more thing. IMA is there to de-stress doctors in the part of stress for their happy living. So please encourage membership and all the schemes like PPLSS and FSS. And with this, thank you, best wishes. Thank you. Over to Sandil, sir.
Thank you so much, sir. So having inaugurated this session and hearing good words and inspirational talks from our various national and state leaders, we now move on to the interesting topic as all are waiting for this particular moment. So IMA CGP headquarters now has curated this program in a very special way with expert panelists and moderators. So the theme of the panel discussion today is from plate to performance. So plate indicates nutrition and performance indicates fitness. So this is how the intersection of nutrition and fitness comes. So let me very shortly introduce our moderators and panelists for the day. Dr. M. Chinnasamy, pediatrician, Erode, Tamil Nadu. Dr. V. Saravanan, Secretary Paramedical Wing, IMA Tamil Nadu. Dr. V.S. Hariharan, Chairman, JDN, IMA Tamil Nadu. And we have expert, renowned, and very prominent panelists for the day. Dr. Palaniyappan Manikam, sir, gastroenterologist and nutrition specialist. So he is from US. And we have Dr. A. Arun Kumar, sir, pediatrician and nutrition specialist from Erode, Tamil Nadu. Dr. Santosh Jacob, sir, orthopedician, orthopedic surgeon and a sports medicine specialist from Tamil Nadu. Dr. Raja Yegambaram, sir, pediatrician from Coimbatore, Tamil Nadu. Mr. Santosh Prem Kumar, fitness coach, Tamil Nadu. So with this, I hand over the session to the moderators and we are going to have a wonderful time. I request everyone to stay tuned till the end and we have extensive questions from all our members. It will be answered as much as possible. Thank you.
Good evening, everybody. This is Dr. Saravanan from Chennai. We'll start the panel discussion right away. This question is to Dr. Palaniyappan Manikam, who is going to answer us from the other side of the globe. Thank you, Dr. Pal, for joining us, and we welcome you. And the first question is fasting feasible for us with our busy schedules as doctors? How long should we fast and how often? What should we eat or avoid during fasting? Is intermittent fasting is based on time restriction or sunrise and sunset base? Over to you, Dr. Pal.
Oh, thank you so much. Thank you so much, Indian Medical Association, for giving me this opportunity. I did my MBBS and PhD medical college in Coimbatore. So I'm a gastroenterologist practicing here in California. So the reason that we've been promoting time-restricted feeding in our practice is I was a living example of how this method worked for me. So I started promoting to other people as well. And I was involved in research on circadian rhythm, and that's where the whole concept got started. So intermittent fasting is not something new. So it has been there forever, right from our ancient practice. And that's why if you see in every religion, there is some kind of fasting that is involved as well. So usually what I tell my patients as well is that the most sustainable method of weight loss, the most important method of weight loss, and the most critical thing of weight loss is how it can be sustainable over a long period of time. And that is the key. Intermittent fasting is not the holy grail. If you have to adopt any other method, it's totally okay as well. It is just that it has to be sustainable. And since this is a meeting very dedicated to doctors and also general public, one thing I have realized time and again, including me, is that while we work so hard to settle in life and to work so hard to be, staging up in our career and making sure that, we are up in the front and state-of-the-art practice, we get advanced in building up our career and we just don't focus on our health. And this is exactly true for almost all the doctors over there. And one practical method where we could potentially take care of that in a sustainable method is this intermittent fasting. And how this works is, as you all know, liver is filled with glycogen, and intermittent fasting is nothing but you are doing a calorie restriction method. So whenever you are restricting calories and all your carbohydrate stores, your glycogen stores in your liver gets depleted, and then the ketone bodies, the fatty acids in your liver gets converted into ketone bodies, and that would be your primary fuel source. And I want everybody to bring focus on two things here. At the cellular level, there are two different components that I want you to bring your attention to. The number one, we call it as mTOR pathway, MTOR, mammalian target of rapamycin, mTOR. The second one is protein kinase, PK, protein kinase. So these two pathways, what it does is, these has three different functions. One is, more importantly, stress resistance. Number two is DNA repair. And number three is autophagy. So what is happening in due course of time is, when we are not taking care of our health at a very molecular level, our resistance habits or the stress resistance level for our cells to any kind of injury, disease, or even like stress levels goes down significantly. And that is one thing that this mTOR pathway and the protein kinase pathway will take care of us if we activate it. The second is DNA repair. As you all know, every cell in our body gets turned over almost on a daily basis. And when it is turned over, the DNA has to be repaired properly. And the DNA repair the pathway has to be stimulated at the right time, and should be given the right amount of duration as well for the DNA to be repaired. And the third one is where we talk about autophagy, where when the DNA repair is happening, sometimes the cells cannot be repaired completely. So those cells have to be basically destroyed and then have to be started all over again. So these three things, stress resistance, DNA repair, and autophagy, has to be stimulated almost on a daily basis, given our work-related stress levels, the food habits that have changed, and lack of physical activity. And one sustainable method for stimulating this pathway is intermittent fasting, which is a method of calorie restriction. So the second question I was asked was, what is the difference between time-restricted feeding and intermittent fasting, right? So what the research that I was involved in, we call it as circadian rhythm research, where we focus on the tiny portion of the hypothalamus. As you all know, it's a suprachiasmatic nucleus. That is your time sensor, where it regulates your circadian rhythm. Can somebody mute the audience, please? I'm hearing my own voice, which is super. They muted me. Good, beautiful. Thank you. And the most important thing, that difference between time restricted feeding and intermittent fasting is basically intermittent fasting can be divided into three different types. One is, before we used to call it as ADF, alternate day fasting. So people do Monday, Wednesday, Friday, Sunday. The idea is you eat a lot on Monday, so you'll compensate on Tuesdays, and Wednesday you eat, and then you compensate on Thursdays. And then they changed to modified ADF, MADF, modified ADF. What that means is they do like 5-2. You eat for 5 days, Monday to Friday, and then you eat on. You don't eat anything on 2 days, Saturday and Sunday. Now what we are doing is we are doing intermittent eating, where every day we eat, every snack we eat, every meal we eat. So there is no rest to the body. So in this, the third method is called TRE, time restricted eating on a daily basis, where you restrict your calorie intake in a particular period of time. And if that particular period of time happens to be late night after sunsets, that supports this our circadian rhythm, where, as you all know, every cell in our body has a sleep-wake cycle, similar to how we go to bed to sleep and then we wake up in the morning. Every cell has its own sleep-wake cycle, and if we respect that sleep-wake cycle by eating early in the day and then having early dinner, then this time-restricted feeding supporting the circadian rhythm might have even more favorable outcomes compared to the intermittent fasting. Again, I just want to emphasize that this method might not be for everybody, but for as busy professionals, as busy doctors, if somebody can start with a minimum of 12 hours to activate the mTOR pathway, to activate the protein kinase pathway, you need a minimum of 12 hours, because after 12 hours is the time where the fuel source switches from carbohydrates to fats, and the fats gets converted to ketone bodies. This metabolic switching happens only after minimum of 12 hours. So, for example, how is that translating into practically at your patient level is when a patient walks into your office, we can ask them, okay, so what time is your dinner? And let's say they say, okay, 8:30 p.m. or 9 p.m. It's okay. We don't have to change that right away. We could say that, why don't you start eating the next meal at 9 a.m. and not before that, so that you can at least give that 12-hour rest to the cellular pathway so that they can get triggered accordingly as well. So, so this is what I practice in my that is what I do in my practice. And as I'm a gastroenterologist, so I see a lot of patients with fatty liver. And one thing we have seen both in fact based on research as well and also on my experience is that this method responds to fatty liver responds to this method significantly. The transaminases SGOT, SGPT gets down in 3 to 4 months. And the key point to this is consistency. And that is the most important thing. And we do from Monday to Friday very well. And then Saturday and Sunday, we have a conference in the evening, conference at night. And then we have weekend get-togethers. And one good thing is you can adopt my practice so that nobody will invite you for any get-together at all, because you know that you're going to spoil the party by not eating late at night.
And my third question, Dr. Pal, it was, what should we eat or avoid during fasting? A quick.
So during fasting is you extend the fasting by using three different techniques. One is you drink water, number one, and number two is you drink black coffee without adding any cream or any sugar, because our
Juice
insulin
coffee.
is so sensitive that even when you taste, like when we cook in the kitchen, and then when we even taste the food, our insulin is so sensitive that it gets triggered even with a tiny bit of an intake of any kind of calories. Even if it is a carb, it triggers even more. So usually during fasting, we extend the fasting by black coffee. That doesn't do anything. And lemon water is good. And then we also say, just plain water by extension. And sometimes, apple cider vinegar and few other things have been shown to extend fasting. But I'm going to be honest with you, I am not a big fan of apple cider vinegar because I couldn't tolerate the taste. But if you can tolerate the taste, that's even better. But during eating, the most important thing we should make sure that is that calorie restriction can help you in weight loss. But you have to absolutely make sure that your protein intake is high so that you don't lose your muscle mass as well. And I can speak for all the other doctors is that when we grew up, we have never focused on muscle strength training. I didn't know anything about it until the last 5 years. Where, I still remember that when my mom saw me go to the gym, she said, you will have time to build your muscle later. First, you build your career first. That's what.
That was earlier.
So,
Okay. Surgeons like us, so we used to stand in the theater almost for at least 3 to 4 hours in a day in the mornings. So, what is the right time for us to fast, intermittent fasting?
So there is no one size fits all. Okay, so I think it is just a trial and error method in terms of what works out for you. So, for example, my gastroenterology schedule started at 7:30 a.m. in the morning, and I have procedures lined up all the way from 7:30 to all the way to 6:30 p.m.
Scopies.
So I started eye scopes, and in US, screening colonoscopy is a big thing. We use colonoscopies as soon as they turn 50, and insurance pays for it, and the patient is happy, we're all happy, everybody is a win-win situation, which should happen eventually in India as well. So 7:30 to 6:30. So I start at 7 a.m., right? So I figured out that for me, if I go for like strict 8 hours eating window and 16 hours of fasting, that is not going to work for me because I feel jittery. and then it is very visible, not to you, but for the other people surrounding you.
Exactly.
So for me, I think I figured out that for me it's 9:30 a.m. to 7:30 p.m. So for me, I figured out the 10-hour eating window works for me. So I drink black coffee in the morning. I extend the fasting window, and then I break my fast at 9:30, and then I do at 7:30. I think as a busy professional, to all the people over here, so many people are over here. I mean, I'm so glad that IMA is doing this. One thing you can take from this discussion is that from tomorrow, you could review your eating time and then see, hey, how can I extend for 12 hours? So let's say today your average dinner time is around like 9 p.m. Don't stress yourself too much to decrease that to 7 p.m. Just start delaying your breakfast time. That is much easier than making your dinner time early.
All right. Thank you. Thanks, Shivam.
Sir, I have a question for you. See, regarding the time, so when is the most ideal time to have your meals? And see, there are a lot of people who have shifts. So Monday, Tuesday, a morning shift, then an afternoon shift, and a night shift. So they keep rotating. So how do they fix their meal time?
So you're talking about working times, morning shift,
the working time is different, right? So their waking and sleeping time differs every day. Like the nurses you have. So
Of course.
yeah.
Of course.
So how
Of course.
do we suggest to them what is the right time to have their meals?
See, I'm going to tell you a blunt truth that we as a medical society has to accept this whether we like it or not, right? We are the worst patients. And it is high time that we prioritize our health. You take care of yourself first, and then you take care of your patients. I think it needs to get reversed. I think we are right from my medical school. We have been focused on treating patients, which is absolutely true. That's why we came into medicine. But to a point that we should not be the patient to start with. We should prioritize us first. I think that is something that we need to understand. Second thing is, we also need to understand in our medical profession, right from the start, it is a service-oriented field. And whenever there is any service-oriented field, there is a compromise to your health, to you are abusing your system to start with. And that is a given, that is a limitation of the field, but there is a lot of benefit that comes out of it. This is the best profession ever that gives you the satisfaction where any other profession can never, ever even think of. Money can be bought in multiple other fields, but the satisfaction will never, ever be given the same way as in the medical field, right? So to start with, not only nurses, look at our doctors, right? How many of them are doing night shifts at 24/7, right? How many of them are got interventional cardiologists waking up at 2 a.m. and then going and putting a stent in? All this is absolutely good until we get this WhatsApp message that, young doctor passed away because of heart attack. And this is absolutely, my heart goes out to them. And this is high time that we take a step back and then see what are we doing. And if you look at the US healthcare system, residents, right? Residents is MD general medicine and residents. They don't have any more 36-hour duties, 24, maximum is like only 18 hours. And they have restricted their time. And that is, it has a pros and cons as well. But one thing that we can take from this system is that the concept of abusing our body is there for all medical professionals. So when we start with that drawback, it is absolutely critical that our diet is the best. It needs to be the best, okay? And given our busy schedule, that is also taking a drawback because we don't have time to focus on our diet. Then the only thing that we can focus on is our time, which is really reasonable to control. And when you are starting the night shift, you understand that, okay, there is a compromise on your health already to start with. So how you can decrease the damage more. So what I do in my night shifts are, I'm also on call as all of you over here. And I told you 7:30 p.m. is my time. So usually I eat a heavy dinner. around like 7:30, 8 p.m. And I try to extend my fasting just with water or lemon water, or I drink apple cider vinegar on that time because, I know that even though that is, I'm not able to tolerate it, I can extend the fasting. And then I eat around like 4 a.m., 5 a.m. in the morning so that the circadian rhythm is not getting disturbed. Yes, of course, my sleep is getting disturbed, which is another drawback to my body. But I realize that is a limitation of the profession, but I will compensate for that in all the other levels, including the time, including the diet, including focusing on catching up on the sleep, catching up on my fitness levels on multiple other days when I'm not on shift.
Thank you, sir.
Okay. Thank you so much. And friends, those who are raising their hands, please put your questions in the chat box. The questions will be sorted out by Dr. Sendil. At the end of the meeting, we'll answer the questions. We'll try to answer if the time permits. Let's finish the panel discussion. Next, we switch over to Dr. Santosh Jacob. He is an orthopedic surgeon and fitness freak from Chennai. Santosh, good evening. How can we incorporate physical? Hello, hi. How can we incorporate physical activity into our busy lives? Can you provide age-appropriate guidelines for cardio and strength training?
Yeah, so absolutely. Before I start, I'm going to be giving out proper protocols. I'm an orthopedic surgeon, so we thrive on protocols. And also, I want to say that like from 2019 onwards, I have completely focused on improving who I am as a machine. I literally focused on my physical health like that. My waist
due to
from
the COVID?
It was actually the funny thing is I heard from my wife when I was 39 that we are going to have a son. That was like a hit on my head, right? Because my waist was 42 and I was 113 kilos. HbA1c was 9. And I thought, okay, like I have to get at least 10 years younger because I'm starting one like 10 years after everybody has. So in my batch, the oldest is actually finishing medicine and the youngest is my second one who's only 4 months. So this part of life, right, has made me focus completely into anti-aging. So I play the game of somebody plays badminton, football and all that, right? I play the game of how can I be the healthiest and most functional 100-year-old. So every exercise I do, all my protocols, all my plans are based on this. So this is from the book Outlive by Peter Attia. He just explains it really, really well. There's a lot of research on it and everything is available. So the concept is if you focus on how you can be the most functional 100-year-old, the first 5 years already you will be the best in that age group. So when we have long-term plans, the way we train, see, all of us, we need a goal to train. So the way we train and why we train is very important. As doctors, we have to fully focus on how to be a really good 80-year-old surgeon. Imagine, we have to train for that. I train for that. So I have told myself that I want to learn from 3 generations of surgeons. So I have to work with 5 generations of surgeons, right? It will be so amazing as a surgeon to do that. And for that, for anybody, you need to have the muscle mass in order for your brain to provide the neuromuscular coordination for you. And all of us, especially doctors who are sitting and who are only standing, who are thinking all the time, we are suffering from sarcopenia without us having an idea. Sarcopenia is when even though we don't lose our body weight, we lose our muscle. Okay, that said, so right now, I'm pretty proud to say that I'm very close to 15% body fat and my six-pack is almost showing. So based on that, I can say that for the last 18 years, I've been writing down protocols because I've also started a chain of personalized training centers where people who have had orthopedic issues can come and exercise and improve their muscle mass and performance. It's not for rehabilitation, it's for improvement of their strength. So what are the protocols? So we need to understand that three things are important as physicians or as anybody who is extremely busy, right? Creativity, commitment, and a little bit of planning. Your planning is what I think none of us do. We plan our appointments, we plan our surgeries, we write down what to read. That we do, but none of us plan any physical activity. So the first thing is you find out what are the cool activities, creative activities which you can do wherever you are, make a commitment and schedule it. So if for children 6 to 17, cardio exercises. Now, cardio exercises are anything which increases your heart rate, which really makes you breathe really hard so that you have to stop and restore your breath and you can continue again. Cardio is just increasing your cardiorespiratory output. So it can be running, jogging, or playing any sport, rowing, even walking. Especially brisk walking is a fantastic idea. So for children, start with 30 minutes a day and you can increase it to 60 minutes a day. Unless they are athletes, there is absolutely no need to force children to exercise on every day. If they are extremely fit, 6 days a week, if they are only starting off, 4 days a week is more than enough. Do children require strength training? They do not, but they require impact exercises. What are impact exercises? Impact exercises are exercises which involve jumping activities where they have to exert a ground reaction force in order to propel themselves up. That actually stimulates all their epiphyses, the physes, and they grow taller. Children who are actively involved in sports, they improve their genetic potential by 9 to 15%. So encourage all children to do cardiorespiratory activities and jumping exercises, sports, volleyball or basketball or football, any activity they like. Please make sure they only do any activity they like. Otherwise, they never continue. The third thing is, from a young age for children, especially if you're bringing them home by car, what you need to do is you need to encourage that you drop them off 500 meters or 1 kilometer without the bag. I tell this to my parents and they say it's a very efficient idea, okay? Because it's in the neighborhood, they know the route and it increases step count easily by 30,000 to 40,000 steps a month, okay? Which is around 30,000 to 40,000 steps a month would be 300 to 400 calories, okay, a month, which will almost be around 1.5 kilos of weight loss every year without any planning. So this is for children. Now, coming to our age group, 18 to 64, here you have to classify it very clearly. Are you somebody who has played any sport in the past, or are you somebody who is completely new, who does not really understand what it is to get into fitness? So I would say if you're somebody new, start with walking. Once you're able to walk consistently 5 days a week for 3 months, walking will get a little boring. Then you can start on a sport and also walk at the same time. Play the sport for 20 minutes. Like I encourage simple activities like throwing the ball to the wall. See, for anybody who is 18 to 64, throwing a ball to the wall and catching it is a fantastic exercise for speed, agility, and for low impact cardio also. Strength training initially start at 2 days a week, increase it to 3 days a week. And especially if you have a sitting job, try to stand before and after every patient. And what I do now, just to increase my steps, is I actually go open my door, say hi to the patient, bring them in, walk back to my chair, and I also leave the patients back.
Exactly.
There are a lot of benefits to that. First of all, it's extremely inviting to the patient. The feedback has been really good. I started this around 9 months ago. The feedback is extremely good. The patients are not really intimidated, and you also really walk a lot, so it is fantastic. The other thing which I do is in my recording place of work, I have dumbbells all the time, and all my gym equipment is right outside. So I really cut down the gym. Should I go to the gym now? No, I would rather see if your equipment is very close, we will somehow do some kind of activity. So if these small changes will really help you. So for our patients who are above 65, when it comes to cardio, you should encourage them to walk and slowly climb up steps. These are the two exercises which is easily accessible for cardio. You should also include for them stability and specifically exercises for flexibility and also mobility of the joints twice a week at least. And they will all have some chronic issue like knee pain, low back pain. Include physiotherapy visits once a month for them so that those exercises they learn. And all these somehow has to be incorporated into the daily lifestyle in an enjoyable way. And you cannot afford to get really bored. So you have to include your cardio, your strength training, and these lifestyle changes in different areas. So like I have around 3 gyms because it gets really boring in the same gym. And like walking also, I have 2 different routes. I don't just walk, I also run. When you're exercising for 4 to 5 years, you have to make it really creative. Otherwise, it becomes really boring. So my general tips, which I tell everybody who just wants to increase their activity, first one is schedule it, okay, just as a meeting. Second one, be efficient. If you're exercising for 15 minutes, exercise properly. No disturbances. Put on the music, exercise. And also incorporate HIIT workouts after you are pretty strong. Third thing, utilize technology. Some apps are very good. Fourth point, mix it up, okay? Just like I told in the previous thing. Fifth thing, also make your social events into movement events. So for example, if you're seeing some friends, instead of seeing them in the restaurant, see them in a place where you will walk some 750 steps. What I do is, I meet them in a mall. We walk in a mall for like 25 minutes, eat something, and we get out. Going straight to a restaurant is a horrible idea, literally, for all of us. After that, active transportation. See, try to walk. Stopping the car really far away from the office, 500 meters or 250 meters is a fantastic idea. Increase walking and try to reduce usage of vehicles whenever you can. Finally, active workstation. So, you need to have the idea that the place where you work, you have to think of it as a spot of activity. Okay, that's what I mean as active workstation. So if Dr. Saravanan is in his clinic, he sees a surgical patient, he shouldn't immediately think, okay, my job is to only diagnose and to operate. He should think, I have to walk at this moment. This is an active workstation for me. Imagine that same attitude 4 hours a day whenever we consult. Okay, we will automatically improve our activity levels. And fine, yeah, sorry.
That's a great thing. See, as you said, you have to walk up to the door, open the door for the patient, greet them, and invite them into the consulting room. This gives in always very beneficial for us and for the patient also. No, they appreciate.
Definitely,
so
I
well.
feel.
So this has been practicing for a long time.
That's why I think you're pretty fit.
Yeah.
Okay, so yeah, so basically, I just want to say, like, as somebody who has attempted in the past for 39 years and failed, right? So the thing is, start small. Okay, don't go for volume. Go for, let me do 2 days a week for 12 weeks. Then increase it to 3 days a week. Okay, because the number of people who I see as my patients who say, sir, 3 masam on exercise armature. 3 months I started to exercise, I had an injury. That's such a common history I get. It's a very common history. So what did you do when I asked? They say, sir, 30 days I went to the gym, 30 days. Oh, that's a very bad idea. Start the gym, be consistent, 2 days. Because one of the principles of strength and conditioning is you do not recover from what you cannot adapt. So you need to rest. It's extremely important. Yeah, so that's the answer to the question. So it's this was just a general exercise advice, I guess.
Thanks. Thank you, Dr. Sandy. And I'm not going to leave Dr. Pal because he's leaving for another city sooner. So you have another 3 questions, Dr. Pal. The next question is, can you give us a diet advice for people who are doing night shifts? Do you specifically mention any diet for them?
So, as we briefly discussed before, that the night shift is an issue because it disturbs the circadian rhythm significantly. And one of the active digestive hormone, as you all know, insulin usually peaks around the afternoon. It gets stimulated by sunlight. Suprachiasmatic nucleus gets started around 7 a.m., 8 a.m., peaks around 2 p.m., and then settles down after 6 p.m., 7 p.m. So when we eat after sunset, usually the insulin hormone gets activated again. And of course, similar to you and me, if anybody is in deep sleep, if somebody wakes you up, you would be so angry in terms of, why did you wake me up? Exactly same thing is happening to insulin. It will keep working for you loyally for a while, and then eventually it will give up. And that is the chance of insulin resistance is significantly high. So during night shift, we can figure out a way to decrease our calorie intake in some form or the other. And number one is, how do we stop producing insulin, stimulating insulin overnight? Is first of all, not eating, which is not practically possible. So what I do is I have a heavy dinner around 7:30, 8 p.m. And sometimes you can extend that as well. And then try to drink green tea, black coffee, water throughout your night shift days, night shift time. And then again, when the circadian rhythm starts early in the morning around 4 a.m., 4:30, then I start have a meal and then we go to bed in the morning around 7, 8 a.m. So that is something I do. The second thing is, let's say that you are not able to do that, then how else you will decrease the stimulation of insulin is to decrease the carb intake. And unfortunately, the most common problem all doctors and busy professionals are having is we are having a mindset that we're doing a night shift and we're stressing ourselves already. So we had this habit of stress eating easily because the lack of available adequate nutritious food is not there during the night shift. So better planning with good high quality protein snacks with nuts and high fiber is one of the alternative option. And I urge everybody who's doing night shift, please make sure that you don't think that you will take care of your diet on the go. Please don't do that. Plan the day before, similar to what Dr. Jacob said. Plan the day before in terms of what you are going to eat at that night for dinner. I really want you to write it down in the calendar and then see whether you're able to stick to it. If you just take it on the go, and then you just invariably will end up eating junk or invariably eating high carb foods, which you are already compromising your insulin at night. So this is one simple trick. I guarantee you that it will go a long way. And after 3 months, you will definitely see some kind of favorable results eventually.
Sir, just to, sorry to interrupt, sir. Actually, there is one question, very important question. Like the time restricted feeding, is it based on the standard timing or the sunset? Because in some countries, the sunset may be earlier or delayed. So that is the one important question many people are asking, sir. So can we?
Correct. Yes. So in India, usually the sun sets around 6:30, 7 p.m. throughout pretty much. But in US, where I am in California, if you take it, it's almost the same climate or weather over here as well. But when I was in Detroit and Boston, sun sets around 4 p.m. East Coast, during winter, and then during summer it sets around 8:30 p.m., 9 p.m. So when you start this method, don't worry too much about when is sun, which time zone that you need to be allocated to, which time zone you need to follow. The first thing that you need to do is to set your circadian rhythm to a particular period of time, regardless of the sunset, to start with, whichever is practically convenient for you, according to your individual environment. And that is why I keep saying that one size doesn't fit all. That every patient is individualized. So let's say that let's say I'm in Detroit in East Coast and the sun sets at 9 p.m. in summer. So I'll still stick to 9:30 a.m. to 7:30 p.m. at that time. And when the sun sets in the winter time around 4:30 p.m., 5 p.m., you could still stick to 9:30 to 7:30 and then trying to decrease that if possible, like a 30 minutes, an hour before. You will be surprised, Senthil, in terms of how even a 10-minute difference, 20-minute difference, the amount of insulin spike that we see in mice labs that we actually were involved in basic science research is absolutely mind-blowing. Absolutely mind-blowing. If you actively get involved in the research, you will be respecting that 1 minute, 2 minute a lot more than what we are doing right now. So the translation of basic science research into the clinical aspect is being replicated with multiple studies now with time-restricted eating. But actual translation for that clinical research to a patient level has to happen through these kind of health education meetings.
Thank you, sir. And also, we just need I think I forgot to introduce your patients and close friends, Mr. Saravakumar, Mr. Tirupati Sundari, and Aragya Swami. So, and there are some questions, they want some references. So can you just share some references in between also? Yes, sir.
We find this Saravakumar everywhere. No, all the videos we find. My friend Saravakumar says. My friend Saravakumar says. Anyway.
Right. Saravakumar is somebody that you will see everywhere, and sometimes it could be you as well.
Sir, we should assume we are Saravakumar, but that helps us. That makes us to remember very well.
Yeah.
Sir, and just one more question from our audience side. So they want to have, since you are from gastroenterology, the gut and our mind health. So that will be a good topic for future. So can you just precisely or concisely try to say something on that, sir? Highlight on that, sir.
So this is a very near and dear topic to me, where I am actively involved in research at a basic science level, where we really are exploring the next level of connection between brain-gut axis. As everybody know, there is an enteric nervous system, which is like multiple neurons, like 1 million neurons surrounding the intestinal system completely, and that gets connected to the brain, as you know, with the afferent and the afferent nerves. So what we are seeing right now is the more stronger the brain-gut axis is, the lower the obesity rates are. And this is how similar to the circadian code research was mind-blowing. This is to the next level, where I can strongly say that any kind of disease, any kind of specialty, any kind of major disorder that you take, I can tell you that the bottom line molecular level will be happening at the gut level. And what is happening is the brain is feeding the enteric nervous system to stimulate the chemicals released and the neurotransmitters based on what you're eating. So if you want dopamine, then you have all these, high craving junk foods. If you want serotonin, and you can plan accordingly as well. If you want GABA, inhibitory neurotransmitter, you could also do that as well. To a point that we're involved in research right now where we are seeing significant amount of mood changes in mice just with changing the diet pattern alone. We could change anxious mice to being depressed, and we could change a depressed mice to being anxious in a span of 2 to 3 months. And we are giving SSRI, right? Selective serotonin reuptake inhibitor. What are we doing in that? We want more serotonin in the body so the patient doesn't be anxious or doesn't being depressed. And the same serotonin can be stimulated in the gut through normal dietary habits and by strengthening the brain-gut axis with mind stimulatory techniques, including meditation, better sleep, and better lifestyle changes. And people in this the medical field should understand that there are like 100 trillion bacteria in our intestine, and these bacteria were present much earlier than we as human beings in this universe. And you should understand, no matter how much you think that you have control over your life, you don't have any control at all. Your bacteria is dictating what it wants, and it will stimulate you to crave for the food, to crave for the actions, and to crave for all the kind of things that the bacteria wants, and your actions are just a byproduct of the bacteria. So this is a very interesting and a very big topic we don't have time to cover completely at this time. But bottom line is that.
Yeah. Sorry. Dr. Paul, can you hear me?
Yes.
No, in this context, what about probiotic supplements? Are they needed, or is it worth it taking probiotics, or at least curd, yogurt, something like that? Will it be useful to improve the mental health?
Right. So coming back to the same concept of brain gut, that's what I was trying to come at, the brain gut axis thing. The gut bacteria is very individualized. It's individualized for Saravanan sir and Sendil sir and me. So it cannot be same for everybody. So, for example, the assumption is that, let's say you are eating curd, you are eating kimchi, and you are eating kefir, or you're eating, kanji from Punjab, or any other fermented food, you are going to get natural probiotic with good probiotic bacteria. But is that bacteria is the actual deficiency that is causing the lack of brain gut axis stimulation? We don't know. And there is no test available as of now, to my knowledge, that will clearly say that, okay, so this bacteria is deficient in Sendil sir. So let's replace this with this probiotic. And then, so Sendil sir will be, super alert and super productive. Unfortunately, there is no research to support it. And there is similar to the human genomic analysis. We have done a genomic analysis for the entire gut bacteria completely of this 100 trillion thing. And it's a huge project that has been spanned over for 15 years. what will happen in the next 5 to 10 years is every patient will have an individualized gut profile where, okay, for this patient, this particular bacteria is depleted. So we will supplement this bacteria for this particular patient. And that is why over-the-counter probiotics will not work for everybody, because we don't know, even though they have 1 billion of bifidobacterium or lactobacillus, whatever is there in this capsule, whether bifidobacterium and lactobacillus is deficient in this particular patient, nobody will be able to say. And with the available assays and with available test available, we could categorize and group together that, okay, so this IBS patients will have this much amount of profile, IBD patients will have this much amount of profile, but is this probiotic supplement is going to help these two people? We don't know. That's the normal answer. So to all my patients, what I say is always go for natural probiotics. Please take curd every day if it is okay with you. And, India is one country where every state has their own natural fermented foods, which we should be very proud
of. One more question, sir. How does sleep quality affect our health and fitness level? And is it the quality or the duration of sleep? Which is...
So it's both. It's both sleep quality and duration. I think duration everybody knows. Okay, so I'm not going to focus on that much. Minimum of 7 hours per day, and we can say that everybody in this call will not get it because you are very active with clinical practice. I want to focus on the quality of the sleep. It's very important that people understand there is a well-documented, validated sleep index called PSQI, Pittsburgh Sleep Quality Index, which is like well research based. Every sleep disorder clinic is using it. I would highly encourage you to look it up as well. It's a PDF, it's an online assessment as well. It's called PSQI. And I want every doctor who's in this call to complete, and also all the other healthcare providers as well, please. Please log in yourself. It's very easy. The questions would be about your sleep latency. Like, for example, how often you had trouble staying awake, how much of a problem you have to get to sleep. Do you wake up in the middle of the night? So it's just a simple questions. And during the simple question, with the simple questions, they will give you a score. And I really want you to understand where you stand. Do you have a good quality sleep, or medium quality sleep, or low quality sleep? Doesn't matter whether you have 8 hours or 9 hours of sleep as well. So PSQI is something that I would recommend everybody to document for themselves, not for your patients. I want you to be the patient first to document the sleep quality. And if it is low or moderate, please subscribe to my channel.
Yes. Thank you so much.
Excellent, sir. Yes, sir. Sir, one question from audience. Can children do intermittent fasting? Is it advisable?
Yeah, good question. Usually, studies have been done only for more than 12 years of age. So less than 12, it's technically not needed, but circadian rhythm gets reset. But after 12 years of age, I wouldn't say intermittent fasting. Fasting is a negative connotation. So I always say eating. So instead of focusing on fasting window, please focus on eating window. Don't say 14 hours of fasting, say 10 hours of eating. It's a small mindset change that will go a long way.
Yeah, that's a good idea.
Yeah.
Thank you.
Thank you. Next question is to Mr. Santosh Prem Kumar. Is there a difference?
Thank you. I'm sorry.
I think
thank you, sir.
Dr.
I have
Pal
to
is
leave
leaving.
for a different
He
meeting.
has to rush
Thank
to
you
the
so
airport.
much.
Yeah.
This is
Sir,
wonderful to meet all of you. Thank you so much for the
Sir, and
opportunity.
before you leave, we need one assurance from you. We all our audience, we want to have your talk on mind-gut connection, probably during our next CGP conference, online conference. So we need some assurance from you, sir, because that is one interesting topic. Yes, sir. Thank you,
Of course, I will coordinate.
Sure,
Thank you, sir. Thank you so much for the opportunity.
Thank you so much, sir. Thank you, sir.
Bye.
Thank you, sir.
Thank you. Bye.
Yes, sir. Thanks.
So I'll just continue my next question to Mr. Santosh Prem Kumar. Is there a difference between indoor and outdoor activities? How to choose which is better for one?
Okay. First of all, I'd like to thank the IMA for having me. I'm Santosh Prem Kumar. I'm a fitness coach. I make content on health and nutrition. just an introduction on me. It's basically the reason as to why I'm here is to engage the public as well. I try to represent them. So the question, coming to the question, it's about answering, outdoor and indoor activities, which is better and everything else. So what we first need to take into consideration is the fact that what are you going to prefer? Okay, so when it comes to, when I'm dealing with my clients and even like public that come and ask me when I see them in the streets and everything, the general question is, they tell me, bro, I don't have any motivation. I'd like to start working out, but whenever I try to do something, I am not able to do it. So the first thing we need to take into consideration is the fact that you need to make it enjoyable for you. Okay, so when we go to parks in the morning, a lot of you will be into walking. That you wake up early in the morning, or else go in the evening with a group of friends, where like you go 1 kilometer, 2 kilometer, 3 kilometer, which you do it for your health. Okay, so why is it even enjoyable in the first place? You get to talk to a group of friends. It's an outdoor activity. You get to engage into what am I doing today, what happened yesterday, and things along those lines. So you have a company set there. So when it comes to outdoor activities, a lot of people prefer walking. But when it comes to indoor activities, we can take into consideration the fact that gymming, even going to a dance studio or anything along those lines that can be practiced at a gymnastic studio, things along those lines. So when it comes to indoor activities, it's a very controlled environment that a fitness studio or even home workouts, as a matter of fact, it allows you to have some type of consistency and convenience regardless of any external factor like weather. For example, I am living in Chennai, so the weather right here is 34 degrees, and sometimes it's even going to 36 degrees. So anyone who does their activities before 6:30 or 7 a.m., they're pretty safe. They can go out, they're fine. But anyone who wakes up late, for example, a lot of surgeons here and doctors are having nighttime practices where you're called upon, but you also need to have 7 hours or 8 hours of sleep at a stretch. So at that time, how will you even be able to, wake up very early in the morning and prioritize your health and go for a walk outside or a run outside or a jog, go cycling and things along those lines? This is where indoor activity like a gym will be of great help to you. There are many centers like 24/7 gyms where like you can go at any time of the day and you can practice, and there will be several trainers to help you there, as a matter of fact. So weather and rain and all these things will not be of hindrance to you, and also it's air conditioned, so it'll be very comfortable for you. And whenever you go into outdoor activities, right, your basic guidance will be watching a YouTube video or watching some content on Instagram, or else taking an advice from a friend, but they are not always going to be there to motivate you, right, or else even correct your forms. For example, when you're going for a running, or else if you're training for a 5 kilometer run or 10 kilometer or even a 20-kilometer marathon, as a matter of fact, there are some technique corrections that are supposed to be in place, or else you can get injured. There's going to be another headache for you. But when you go to a place like a gym or a dance studio, there are going to be several trainers. And the basic gym membership will cost you about 10,000 rupees a year or 8,000 rupees a year. They heavily discount their activities. But when it comes to an outdoor activity, it's completely free. You can go to any public park. But the basic thing that you will be missing out is the guidance. And lastly, I have to say that safety aspect is a major role. So whenever you go into a gym or any indoor place, safety is of major concern for a lot of you people. So there are cameras and there are other people with a similar mindset coming in there. So you're well protected. But when you go for an outdoor walk or even an outdoor run or things along those lines, you don't know who you come across. Whenever you're going with a group of people, it may be very easy for you because you're well protected. It's your people. They know who you are and everything along those lines. But not everybody will be blessed with that. And like I told you, many of you will be having night practices, or even early in the morning when you're having to go to the hospital at 6 a.m. or 7 a.m. It can be very difficult for you. So when you're considering safety, indoor activity will be preferential to you. And also, finally, even though we live in India, where the sun is not setting at 4 p.m. or 3 p.m. in the afternoon, late in the afternoon or in the evening, we have a lot of people have vitamin D deficiency. So whenever we are going into any type of indoor activity, we are not getting exposed to vitamin D. It's a huge problem that many individuals in India are facing. This can lead to a lot more hunger and reduction in testosterone levels And there's a cascade of things which can result from deficiency in vitamin D. And unnecessarily, we are going to switch to a vitamin D pill, which is taken on an everyday basis. And as we know, like anyone can get a vitamin D tablet, and not many people are, taking the consultancy of a doctor or a well-trained professionals. So it can even lead to vitamin D toxicity. We want to prevent these things. So what I suggest is combine both these things, an indoor as well as an outdoor activity. Go for a brisk walk whenever you find or have the time in the day. Get your vitamin D and go to a gym, sign up to a gym. There will be many people to motivate you for that. So that's my answer for this.
Right. Right. So now request Dr. Chinnasamy sir to put forward his question to Dr. Arun sir. Arun sir has just joined. Please kindly put forward your question to Dr. Arun sir.
Oh, that's good. But I have a question to Dr. Santosh Jacob.
Yes, sir.
Can I ask him?
Yes, sir.
Dr. Santosh?
So, yes, sir. I'm here.
Right. Right,
Good evening,
sir. Good evening. After seeing your inspiring Insta reel and reading
Thank
that
you, sir.
Peter Attia's book, I started
sir.
working out last year.
Sir, I'm so happy,
And
sir. to hear.
that's good. And as a matter of committing myself and posting something, I posted my gym pictures to everyone in my group and family group and classmates. But since that day, very frequently I'm getting some messages scaring the shit out of you. That doctor died in the gym. That doctor collapsed while doing bench press. Like that. There are events of sudden cardiac deaths happening
sir.
in the gym.
Yes, sir.
Say something about it. Is there any way we can prevent those?
Yes, sir. Actually, my next talk is exactly that, sir.
That's good.
That's exactly the question. So, can I start the next talk, Dr. Saravanan?
Yes, sir. Please.
Santosh, please go ahead. Please
Super.
go ahead. You want to share the screen? You want to share the screen?
Yes, I will share
Yeah,
the
please.
screen, and I have also added the reference and to all the doctors. So the textbook I use. So my educational background would be orthopedics, regenerative medicine, and then sports and conditioning. So this is the textbook I use. It's called Essentials of Strength and Conditioning. You can just, and it's by the NSCA. It's a solid book. It's actually everything we have already read. It's physiology, biochemistry. It's a combination of that. The anatomy is super easy. We all know that. We have all read that so many times. This is one book I use, and the other one is called The Science of Strength Training. It's a colored book, and it's extremely easy to understand. For all of us, it's very anatomical. This is the book. I will add the names of the books also. You can get this off Amazon. Both the books I showed, and you guys can, and it'll be extremely enjoyable because we can easily understand that. It will only take us like 3 months' time. After that, you just learn exercises. That's what you do. So coming to the...
Is it available online, sir?
Yes. On
okay,
Amazon
sir.
itself.
Online. Okay.
It is available. Yeah.
Fine, sir.
Both the books are available online.
Yes.
So the first book is like a proper textbook. It's like Genong's Physiology. It's like hardcore text. The second one is much easier. So those are okay. So the protocols are from this and a paper I added. So the first thing they say is, especially our goal would be to prevent cardiac arrests, right? Especially when somebody is starting a new routine. First thing is, all of us should understand we have to recognize the risk factors. It's very, very important. Second, we have to understand that everybody has a personal health status. Third thing is, we need to take precautions even if everything appears safe, especially as a doctor when we are prescribing exercises. All the 3 points are stressed about. So what are the steps we take? First step is you have to have a pre-exercise health assessment. What is that? a review of his medical history. First one is any known diseases, family history of heart disease, any symptoms. We can very clearly ask every patient, chest pain, dizziness, or any shortness of breath. The next thing, physical examination. Ask them to walk 2 flights of steps. And if they have any breathlessness, that itself is an indication. The next one is risk factor analysis, identification of lifestyle. Smoking is extremely important. Blood pressure, high cholesterol, diabetes, obesity, and overall, if they have a sedentary lifestyle is very important. So this pre-exercise health assessment has to be done for everybody. After that, I do a CV screening. First one is ECG to check. I definitely do it. And if it's an obese patient who's extremely motivated, right? Some of them are like, they just want to lose right away. With them, I'm extremely cautious because, guys, trust me, you guys have no idea how many drugs are in the market. 17-year-olds, 18-year-olds, it's just rampant. I have 21-year-olds who have a testosterone. See, the normal is 300 to 960. Some of them have 2,600 and they have no idea. It's just that they are promoted as weight loss stuff. So you need to be aware that any patient who has gone to the gym and they come to you, they might have a possibility of using this stuff. So I do an EKG. Younger patients, I actually do a stress ECG. Sometimes if it's required, if they are patients who have any of the risks, I send them to a cardiologist and they always do an echocardiogram and they tell me how much I can allow them to exercise. Classically, like 3 to 4 days, moderate intensity, stuff like that. And based on it, we work out a protocol. Then we have fitness assessments. These are also extremely interesting. So simple evaluations. If you are going to a trainer, right? Invest in a trainer who's educated, certified. And they should have already asked you to do the tests of a VO2 max, which is extremely important. A walking test, a jogging test. These are simple tests you can do anywhere. We do this. So I also have a fitness center in Chennai called Ageless. That's where I have all these protocols and that's why I know so much. We do all this. All these are followed on a regular basis in every patient we train so that we are safe. Then we do something known as a functional movement screen. That is, after 40, everybody has some restriction of range of motion. So if they have a restriction in the knee, definitely they will benefit by us focusing on exercises, strengthening the alternate joints, stuff like that. And also it helps us reduce the exercises which otherwise would cause stress on the specific arthritic joint. So a functional movement screen is very important because any pain during exercise or any aggravation of inflammation during exercise, right? If it's excess inflammation, already they are obese, they are stressed, they are exercising, they're increasing their heart rate. All this, after some time, the body adapts and homeostasis comes, right? But the process of going there, we have to make sure that they don't overdo it also. And all these screenings really, really help. And even after this, you have to have a personalized exercise plan, okay? Based on, I'll just be extremely short, intensity, okay? Always in a week, you have to have a day of low intensity, moderate intensity, high intensity. If you have a trainer, you can't go high all the time. You'll get injured. Don't do that. Intensity is extremely important. Type of exercises. your trainer should not ask you to do same type of exercises. It should involve 7 components: flexibility, mobility, stability, speed, agility, quickness, resistance. It's like a lot of components. So only focusing on strength is not at all a good idea. We have to focus on the things we do every day. So type of exercise is important. Then frequency and duration. I advise only 12 days of exercise in a month. That's more than enough. But what I say is, give me 144 days a year, right? 12 days a month, 144 days a year. 144 days a year, it will be a huge difference in your physical appearance and your health. What we do is full of motivation. 30 days, we just go 25 days. Afterwards, everything burns out. We don't go back. So have to avoid that. Finally, we can also take some preventative measures. First one is always warm up, cool down. If you're exercising for 40 minutes, warm up for 20 minutes using a protocol called the RAM protocol, warm down for 10 minutes. It will help your recovery, especially your heart, to settle down. It will really help. If you go from that to another stressful activity, you're really not allowing recovery time. You have to allow recovery time. Hydration, water is very important. Electrolytes are important. And also listen to your body, man. If you have fatigue, okay, or stress or gastritis, don't exercise that day. It's okay. One day, see, if your plan is to be a really strong 100-year-old, why will you focus on that one day when you're really stressed? It won't really matter. Rest. If you're tired, take a rest week also. See, always remember, it's hard for your body to adapt if you do not recover and if you do not feed your body. If you're feeling unfit, remember, exercise is almost like a surgery, right? If you're unsure, you will not go into operate. Same way, if you're unsure, like if you're sick or something, or you feel that you're stressed, don't do a stressful exercise. Do an exercise like walking or swimming or flexibility or yoga or core control, stuff like that. Do exercises, don't do exercises which directly stress your heart. We have to do stuff like this. It is extremely important. Then the most important thing is progress gradually. Take 2 to 3 years in order to increase your strength. Remember, 100 is a long time, right? If we believe that that is the game, okay, whatever happens, we will be a better, younger version of that age. And in order to do that, these are the protocols to follow. And we also ask all our patients to see their cardiologist every 6 months. This really helps.
Right. That's
So
good.
one question, sir. We know that you do musculoskeletal ultrasound very often.
Yeah. Yes.
Do you have some practical application in fitness and sports injuries or in
So, sir,
training?
I will tell you, I have a acromioclavicular disruption type 3. Technically, I should operate, but like if I get it operated, I might have some restriction of motion. So I have just used exercises, strength training, all the principles, and I am able to do 10 pull-ups now. I do 40 push-ups straight. So my understanding is the only thing you can really manipulate at any age is muscle. The reason is every muscle has active stem cells called satellite cells. Why aren't the satellite cells working? Because we don't have enough protein there for muscle protein synthesis or tissue protein synthesis. So even as we age, if we are stimulating the muscle injury with exercise and eating enough protein, our muscle will remain large. I have seen 76-year-olds able to do more pull-ups than me. It's all in how we injure ourselves right, rest, feed ourselves, adapt. It's extremely important. Remember, manipulate what you can manipulate easily. You can increase your cross-sectional area of the muscle way more easily than you can burn your fat. Okay. So focus on that.
Thank you. Thank you, Dr. Sandy. Thanks for the expert opinion. Next, may I invite Dr. A. Arun Kumar, who's a pediatrician and a nutritionist, for a few questions. Welcome, Dr. Arun Kumar.
Thank you.
Dr. Arun Kumar?
Yes, sir, I'm there. Yeah.
Hi. See, I just have a simple question. What are some simple tips for managing weight that actually work without having to try different diets that never seems to sick? No?
Yeah. So before that, I would like to thank the IMA CGP team for having me invited here for this wonderful panel discussion. And then I would like to extend my greetings on behalf of our Lifestyle Modification and Wellness Committee of IMA, where we are actually intervening in the lifestyle of the healthcare practitioners. We have formed a Lifestyle Modification Committee with more than 1,200 members. And there are more than 300 members after taking all the blood investigations, ultrasound, all the basic workup, all the metabolic workup. We have advised proper customized dietary regimens like intermittent fasting or low carbohydrate diet or modified low carbohydrate diet or a balanced low calorie diets as per their individual willingness and at the same time their medical problems. And wonderful things are going on with the help of all our admins and our team members. Excellent things are going on. So those medical practitioners who are listening to this, those who haven't still heard about this, please just search IMA Nalam Tana is our program name. You can just search in YouTube. You can find our YouTube channel and all the rest of the details. So how to join this Lifestyle Modification and Wellness Committee, everything is there. So I would like to come back to my question. So regarding the weight loss. So weight loss, it is always seen as like a fancier thing. So at each point of time, people will be trying out different means for trying out weight loss. Like at one point of time, everyone was following a particular type of diet. Then after some point of time around 2018-17, everyone was following a low carbohydrate diet in Tamil Nadu, like paleo diet, low carb diet was famous. Now everyone is focusing towards intermittent fasting. So it is not just one type of diet helps and one type of diet doesn't help. So it is all about understanding the key concepts. So I will just present share a single slide. So in which I will be able to explain everything in just a single slide. So all the concepts of weight loss. So we have always been the medical community. We have always saying that weight loss is all about balancing the calories. Yes, true. It is all about the balancing the calories. But it is not just about balancing the calories. If the balancing calories was just a simple thing, then everyone would be able to just eat less, work out more, and everyone would have come to normal weight by now. So like just to understand that to lose weight, you have to lower down the calories and eat less or work out more is not something a rocket science or something. But the thing is, we are not understanding the other factors which play a vital role in managing the weight. So even as I would always quote in a presentation, in the latest textbook of Harrison says, the weight loss and weight regulation cannot be just explained based on a simple calorie in and calorie out. So just based on explicit calorie balance, because whenever we try to eat less, our body tends to stimulate the hunger hormones and it makes us eat more. Or whenever a person tries to eat less, the body tries to conserve energy to avoid losing further weight. So that is why most of the people who try to lose weight reach some plateau, hit some plateau, they will say, I lost some 5 kg, 6 kg, 7 kg, then I was not losing any more weight. So always the body resists weight loss from an evolutionary point of view. So just we have to understand this single slide. So this thing. So I would like to explain the weight gain and weight loss from an insulin perspective. So we are talking more and more of insulin. Dr. Pal spoke about it. So from an insulin perspective, so whichever we all know, insulin is the main hormone which stores fat. So we all know. So whatever we eat, so whatever the excess, either if we do any activity, the sugars will go to the muscles, all the skeletal muscles will take up all the sugars. So it is fine, and all the organs which are actively functioning will take up all the glucose. So we all know that. And some amount of extra glucose will go to the liver. We all know that. And whatever is remaining, the insulin will push all the glucose, convert it into triacylglycerols, and it will store in the adipose tissue as triacylglycerol, or the fatty acid esters. So this is what, whenever this adipose tissue, the fat storage is more, we call it as obesity, right? Okay. So from an insulin perspective, whichever increases the insulin, that actually causes more fat storage. So just simple things. So the most stimulating factor is a high carbohydrate diet. So any diet which is high in carbohydrates, definitely it stimulates insulin to a lot more extent. And if you combine carbohydrates with more fat and protein, like if you take the same amount of carbohydrates, some more fat and protein. So whenever we say, like from a general public perspective, we all say biryani sapta weight podo, or they will say like when we eat bhaji or when we eat a fried snack, they always tend to think, okay, it causes more weight gain. That is right to some extent, because it contains a good amount of carbohydrates combined with the excess of fats and all that. So it causes more insulin spike. And we must understand the proteins and fats. That too, the main thing is the fat, the dietary fat is having the least insulin spiking response inside the body. So whichever is high carbohydrate, maximum insulin spike, and some proteins and fats, least insulin spike. So in any high calorie diet, so this is actually, it is both. So a diet high in calories, empty calories, it will always contain a high carbohydrate content. So these both are same actually. So in frequent meals and snacking. So whenever we keep on eating frequently, so we are keeping on spiking the insulin, that leads to more weight gain. So we always say 3 meals and 3 snacks from a patient perspective, but for weight gain, it is actually a wrong advice. So then any sedentary lifestyle. So whenever it's a sedentary lifestyle, so because we are not working out, and there is no all the glucose that the body generates from our food doesn't go to the skeletal muscles. So the excess has to go to the adipose tissue or the liver and stored as a fatty liver. And all the empty calories. So like that just gives too much of glucose, like any cool drinks or any just sweets and sugars. All these empty calories just increase insulin. So whichever decreases insulin will cause weight loss. So as simple as that. So any low carbohydrate diet, so any diet you follow. So even I would say, even a low calorie diet works basically because of ultimately, again, we are reducing the carbohydrate. So instead of eating 4 idlis, if a person eats 2 idlis, again, the thing is, he's actually reducing the amount of carbohydrate that he eats. So that is why a low calorie diet also works basically because it again reduces the carbohydrate load, and hence decreasing the insulin spike, then and hence decreases the fat storage and causes more fat burning. So whenever we consolidate meals, so instead of eating like 3 meals and 3 snacks, if we try to consolidate the meals, just like Dr. Pal said, intermittent fasting. So we eat within a span of say 8 hours or 6 hours or 10 hours. If we consolidate the meals, then what happens is when we consolidate the meals, the insulin, like if we eat within a span of 8 hours, just 2 meals and a snack, and if for 16 hours, if we remain fasting, then again, the fat store burning is more. And any high intensity exercise, a cardio or a strength training, so any high intensity exercise, again, it will have a better insulin sensitivity, and it will more than just burning the calories, it will increase the insulin sensitivity, and it will push all the excess glucose and into the skeletal muscles rather than into the adipose tissue. and any high nutrient dense food instead of empty calories. So if we say like if one has to have some 200 calories, I would always say 200 calories is just one small piece of Mysore pa. But 200 calories, if you want to take from a sprouted dal or something, a sprouted moong dal, you have to take one bowl of sprouted dal to get 200 calories. But at the same time, if you want to have 200 calories from a carrot, then we have to take at least some 400 to 500 grams of carrot, half a kg of carrot to get just some 200 calories from carrot. So high nutrient density plays a role. So all these factors. So no need to go for a specific diet. So restrict your carbohydrates, consolidate your meals, go for high nutrient dense foods, combined with the exercise, and that is more than enough. Definitely the weight loss is going to happen. So this chart will be the mantra for weight loss.
Thank you, Dr. Arun. It was an excellent, great explanation in a single slide. Next, can I invite Dr. Raja Ekambaram, the pediatrician, for a question. Dr. Raja? Dr. Raja Ekambaram is there? Can you unmute and speak, sir? Dr. Raja?
So I'm just checking with him, sir. We can proceed with the next question.
So we'll proceed with Mr. Santosh Prem Kumar. Mr. Santosh? Can I ask you a question, Mr. Santosh?
Can I ask Arun Kumar a question if Dr. Santosh?
Or Dr. Arun, one more question to you.
Yeah.
How can we plan meals to stay healthy despite our busy schedules? What nutrients should we focus on getting every day? That's the question to you.
Yeah. So the main thing is what a balanced diet. So the balanced diet, the word itself is a myth, I would say, because what is balanced for one person may not be balanced for another person. So whenever a person asks for a patient coming to me for nutritional advice, whenever he asks, so give me a balanced diet. So I would say like if you are say if your salary is 50,000 per month, and if you are earning 1 lakh per month, then you would say, okay, it is a very good salary. You will be happy. Say if the same Mukesh Ambani from tomorrow, from the next month, he earns only 1 lakh rupees a month. So it is almost like bankrupt for Mukesh Ambani. So it is what may be right for one person may not be apt for another person. So it is balanced is a myth, I would say, even though the World Health Organization and all the multiple various health organizations try to give some definition and try to fit in a concept called balance. So generally they say some 40% carbohydrates, some 30% protein, some 30% healthy fats. So that is fine. But the thing is, it all depends on other metabolic problems. If one has, say, if a person has an obesity, if a person has type 2 diabetes, PCOS, fatty liver, then the balance is different. So I will just tell from a general perspective, say if a person doesn't have obesity or diabetes or PCOS or fatty liver, if the person normal weight, metabolically healthy, no fatty liver and all these issues, then what are the nutrients we have to try to achieve? So what I would say is, so main thing, we are already taking enough of carbohydrates. There is no doubt, especially South Indians or just Indians in particular, we take enough of carbohydrates. So there is no lack of carbohydrates in our diet. And even vegetables and fruits, okay, we speak about it a lot. Vegetables are healthy, fruits are healthy. We somehow try to fit in. So even at least most of us know that, we have to take. Regarding proteins now, because many of the many of the doctors are speaking, the healthcare practitioners, all the fitness people are speaking about protein. So some thing about the awareness about protein is going on. So no issues. And regarding healthy fats, so fat is the problem. So because even the fear of protein is slowly coming down among the medical practitioners, but the fear of fat is yet to come down. So what I would say is, so macronutrients, micronutrients. So macronutrients, I will just say simple concept. So I will just easy to remember. So what I advise to my patients, that is what I am telling here. So in just a general balanced diet, I would say each 3 meal concentrate on one particular macronutrient. So what is the macronutrient? So for I will always say for breakfast, instead of loading too much of carbohydrates, what I would say is for breakfast, take a healthy fatty meal. Fatty meal, it can be nuts, it can be groundnuts, or it can be coconut, or it can be some eggs you can take. So any healthy fatty meal that can be taken, and most of these fatty meals naturally will contain good amount of proteins also. So we'll be taking, and most of the nuts and all these will contain good amount of fiber also, and you can add some vegetables, no issues. So for breakfast, concentrate on taking healthy fats, as simple as that. For lunch, you can take whatever carbohydrates you want. So whether it is rice or roti or chapati or millets or whatever carbohydrates you want. And what I would say is, whatever quantity of the grains or millets you are taking, please take equal quantity of vegetables. So whatever, say 1 cup of rice, if it is 1 cup of millets, please take equal quantity of vegetables. So in that way, you are giving a good amount of fiber and all the micronutrients, the vitamins and minerals. So all the minerals will be getting from the nuts and other things we said in the breakfast also. So the lunch will contain the carbohydrates. So both the grains-based starchy carbohydrates and the vegetable-based fibrous non-starchy carbohydrates. So for lunch, we will focus on this. And in addition to that, we can add some proteins. So a couple of eggs, or if a vegetarian, some 1 cup of moong dal or something like that, it's fine. And I will always say for dinner, focus on proteins. So if you want to take like some chapati or roti or whatever, you can just take one or two dosa, chapati, something like that, and add good amount of proteins, whether it is non-vegetarian or it is mutton or chicken, or it is a vegetarian, you can take paneer or any sprouts and pulses, or it is soya or mushroom. So the dinner, we shall focus on protein. So breakfast, healthy fats; lunch, some good amount of carbohydrates, both starchy and non-starchy; and dinner, proteins. And vegetables, we can take in all 3 meals. Fruits, I would always say, take in moderation. No need to take too much of fruits. So some 120 grams of fruits per day is more than enough. Anyway, we will be getting a lot of all other micronutrients from our vegetables. So in this way, we will be able to balance out all the micro. No need to bother much. But in case the person is having obesity or type 2 diabetes or fatty liver, definitely we have to cut down on the carbohydrate load and increase the healthy fats, and increase on the proteins, and increase on the vegetables. So the balance has to tilt in another angle. So that is what we must remember. Thank you, sir.
Thank you. Thank you, Dr. Arun. Next, I invite Dr. Raja Ekambaram, who's a pediatrician. Being pediatrician, Dr. Raja, good evening.
Good evening, sir.
Hi.
Am I
How
audible,
can
sir?
we? Yeah,
Am I
you're
audible?
audible. You're audible. You're audible.
Yes.
And how can we ensure our kids eat healthy amidst the rise of junk food and aggressive marketing? Because if you open the television, it's almost every 10 seconds, some food is coming, or oil at least. Oil is coming on the television screen. So how can you make sure our kids eat healthy?
Yes, sir. Junk food industry is 330 billion industry in 2022. It is going to increase another 100 billion in another 5 years. So children easily fall into this advertisement through social media, TV, internet. So
exactly,
children normally they imitate their parents. So parent must make sure that eating nutritious home cooked meals. They should set some example to the.
எதுங்க சார் நம்ம ஒரு அதான் எல்லாத்துக்கும் கொஞ்சம் ஒரு ரவுண்ட் மாதிரி பண்ணி.
So parents must make sure that they eat nutritious and home cooked meals. Advertisement make children to eat more fast food and sugary drinks. Make them to eat meals in time. And adequate proteins in meals reduces craving in children. Ask children to consume snacks that are nutritious and low in calories. Good proteins will reduce appetite and reduce craving. Eating junk foods is it audible, sir?
Yes, sir.
Dr. Raja, your line is a little low. Yeah, now is
it
fine.
audible?
Yeah.
Yes, sir.
So eating junk foods may be enjoyable to the kids, but consume it regularly is harmful. Children's body can undergo changes that are linked to diseases in the later age. So junk foods causes rapid and unhealthy weight gain. Now childhood obesity is also in rise. Nearly 390 millions are obese. It is nearly 8 to 10% children are obese. So junk foods are addictive due to their high sugar and salt content. So my advice is parents and family members should set the example to the children. They should follow good eating habits and eat homemade snacks and healthy food. By the way, children can take 100% avoiding junk foods by children is not possible. They can reduce.
You have to go with them. Correct.
Yes.
Then, Dr. Raja.
Thank you.
Yes,
Thank
sir.
you, sir.
Sir, are you hear me now?
Yeah.
Yes, sir.
Santosh?
You are not audible.
Yeah. Yes, sir. Yes, sir. I'm there. Santosh, I'm here.
Okay, I listen to you.
Yeah.
The thing is going to the gym, is it only for the younger people or even the oldies can?
Yeah. So coming to that question, as Dr. Santosh Jacob was saying, muscle is the only manipulatable organ at any age that you are in. Okay, so it's also called the age reversible organ. You can start at anywhere. For example, I am a 22-year-old. So when I am starting, I have a lot more time with me. That is, I can progress a lot faster than probably a 50 or a 60-year-old. But at the end of the day, all the age group, whenever they start, they are going to progress. So that is what we have to keep into consideration. So strength training is not exclusively to gym enthusiasts. It's also highly beneficial for individuals at all ages. So let me come to the first benefit that older people or, like older individuals, older adults are going to experience: muscle mass and strength. Okay. So as individuals age, there is a natural decline in muscle mass and the strength and a condition known as sarcopenia. So even, Dr. Santosh Jacob was saying, as surgeons, when they're performing for an extended period of time, you might have 3 hours or 4 hours or even 6 hours. As a matter of fact, as you age, when you're not stimulating your muscles enough, you might start experiencing certain pain or discomfort. This is purely due to the fact that you're losing muscle and you're losing strength. So the only way to counteract this is by engaging in strength training, weightlifting, or resistance training. As a matter of fact, this is definitely going to have an increase in your muscle mass and strength, leads to more functional abilities and mobility. And second of all is bone health. So strength training is essential for maintaining bone health and reducing the risk of osteoporosis, a condition characterized by weak bones. So when, older individuals, like for example, like even while walking or things along those lines, they might experience knee pain, or is even when they are, engaging in certain household activities. We hear about, my grandmom, or like, our moms who are older, they tend to engage in certain household activities and there may be water on the floor. Suddenly they slip and then they have a hip fracture, or they get their bones fractured due to several reasons. But when the same thing happens to a kid who's 15 years or 10 years, when he falls on the ground, he's not getting his bones fractured, right? That's because of the fact that as we are aging, the bone health reduces. But engaging in strength training can effectively enhance bone mineral density, thereby reducing the risk of fractures and falls in older adults. And most importantly, also functional independence. We see, older adults, start experiencing knee pain and many things along those lines. They generally need a person to help them, or even if not, they need a walking stick. Or when they go to airports, there is a separate queue that is dedicated for older adults, where they are taken on, a wheelchair because they are not able to walk as fast as other people. this can be completely avoided if we take them into strength training, because like I said, muscle mass is definitely going to improve, strength is also going to improve, and also your bone density. But what we need to take into consideration is the fact that form is really important, because the risk of injury can be very high for them. Because when you are starting as a complete beginner, you are at a weaker state compared to the one who is young. He is very energetic. He can perform all these things. Even if he gets injured, he can recover at a much faster rate compared to other, an older individual. So this is what we need to take into consideration. So they need to hire a proper trainer for this to happen. So a trainer will be able to watch them, correct their form, and things along those lines. When I go to when I go to the gym that I go to, it's a club gym. A lot of older individuals come there. There are a lot of people who are pumping weights at 60 years and 50 years, having extremely good muscle mass, and they don't seem to have any help that is needed by someone. They are completely functionally independent. And as Dr. Paul and as Dr. Arun were also speaking about insulin sensitivity, and as Dr. Arun mentioned, that an increase in muscle mass will make the insulin transport the excessive glucose to your muscles and store it as glycogen rather than sending it for adipose tissue. So we don't need any more fat gain, right? Especially there will be obviously a reduction in metabolism due to age, but we can counteract that by putting on more muscle mass, and that can only be done through strength training and putting more muscle. So a lot more hormonal functions can be at peak level, and you're constantly stimulating yourself every day, right? So there's a concept of managing your stress levels. As you get older, you have a lot of responsibilities on your plate. You need to deal with a lot of things on a regular basis. A kid is not stressed as much as a man who's dealing with his business. And a matter of fact, you are doctors seeing a lot of people on a regular basis, which can be very, difficult for you. You'll be stressed out all the time. So it's all about maintaining your cortisol spikes in a day. So when we, as adults, go and engage in some sort of physical activity, we are talking about strength training specifically here. You're purposefully putting yourself in a situation where you are stressed. Okay, so you are taking into control of your cortisol spikes. So when the cortisol that is produced throughout the day is mostly the same amount, but when you engage in an activity earlier in the morning, like going for a jog, or engaging in a very physical and demanding activity like weightlifting, you are getting a peak up in the day. So when you're getting done with the major spike in the morning, you're very much controlled throughout the day. So when you're handling some stressful situations, you tend to be a lot calmer, and that is exactly what we want, right? And also Dr. Paul was faced with the question of sleep, how important is sleep. And he told you have to focus on the quality of your sleep. So even if you're going to bed at 8 p.m. or 9 p.m., if you're not able to sleep properly, but you're still laying in bed just due to stress, if you engage in, strength training and weightlifting earlier in the morning or whenever is possible for you, you manage your cortisol spikes, you improve your serotonin and dopamine production, you improve your brain and gut axis. It's only going to lead to benefits for you. And that's the reason as to why I would say it's not only for gym enthusiasts, it's for everyone.
It's good. But many of us old people too, and we start going to the gym as sarcopenic individuals. Okay. We are being asked by our trainers and nutritional people to eat a little caloric surplus to put on some muscle while doing weightlifting. But what happens? We end up big belly also.
So I totally get your question. So what you're trying to ask me is, can we just lose fat and build muscle at the same time? Because none of us want bellies, right? But that's not the whole picture that we are trying to get here, because there is also something called a healthy body fat range. So for example, I am into comparative bodybuilding as well. So we take our body fat percentage all the way up to 6% and 7%, which is dangerously low for anyone. Can you hear me?
I do. That's great. 6 to
Yeah,
7. Wow.
Yeah. So, but it's not advisable, right? Anywhere, if a man, if he has a body fat percentage anywhere from 15 to 20%, he's in the perfectly healthy range. But when we are trying to focus too much on our aesthetics, even for younger individuals as well, we tend to lose the focus of proper hormonal balance that we are supposed to have. So rather than looking at, I want to look a certain way, how healthy can I be, and what's the right amount of fat percentage is required for my body. So it's also individual specific, right? Dr. Sanjay Jacob was mentioning about the fact that you need to individualize your training and your nutrition. So like a person like me, I'm very much comfortable when I'm at my 17 or 18% body fat. My mood is good. I feel all right. My appetite is great. I don't starve myself. I don't feel like I want to go eat something. But a person will function great at 10% or 12%. It's very individual specific, like I mentioned. So you need to figure out as to what amount of fat percentage my body will be comfortable at. What will I feel the great at? So that is supposed to be considered initially. But moving on to the fact that you were asking me about protein prioritized meals and being in a caloric surplus. But you were also concerned about the fact that I shouldn't be putting on more fat if I'm in a caloric surplus. So what can I best do? So the process of trying to lose fat and build muscle is termed as body recomposition. But this can only be done during, at these 4 levels. That is, when you are a beginner, when you go to the gym at the first place, you'll obviously lose fat and build muscle because you're engaging in some type of activity and you're getting stimulus. And second of all, when a person is extremely overweight, so even if he's being in a caloric deficit or maintenance or something along those lines, he can still lose fat and build muscle. At least his body fat percentage is reducing because the muscle mass in terms, when compared to the body fat level that he's having, muscle mass is increasing, but body fat percentage can remain the same. And also coming back to the gym and training after a long time. So what we actually need to prioritize is, don't worry about protein. Dr. Arun also mentioned the fact that, for the longest time, we have been told that yeah. So Dr. Arun also mentioned about the fact that for the longest time, we have been fearing about eating a lot of protein, which is totally not the case. We can and we should have a lot of protein. Even Dr. Sanjay Jacob was mentioning that only due to lack of protein, we are not able to, grow muscle or maintain muscle mass. So have a lot of meats and eggs. Like how your trainer is supposedly saying that you need to have protein prioritized meals and caloric surplus. You needn't have to have caloric surplus. You can have protein, you can eat at maintenance if you're too worried about putting on fat. Because like I told, as you keep building muscle mass, your body fat percentage, even if you're having caloric maintenance, is definitely going to reduce because it's direct proportion. And then the question also continues with the fact that if I put on enough amount of muscle mass, am I supposed to be on a cut or reduce? So we needn't have to even get there. Stay at a place where you are comfortable, go to the gym, eat at a caloric maintenance and have protein. I personally take 1.5 grams to 2 grams of protein, my body weight. And as Dr. Sanjay Jacob was mentioning, Dr. Peter Attia, he has also mentioned about the fact that as we get older, we are supposed to prioritize more protein compared to the contrary belief saying that don't eat a lot of protein, you will not be able to digest it, you will have gastric and kidney issues, which is not going to happen unless someone already has pre-existing kidney issues. So be confident, have protein prioritized meals, progressively overload, go to the gym on a regular and consistent basis, get the help of a trainer, make sure your form is correct, and everything will be fine.
Thank you. I have another question as well, a gym question. Can I ask?
Yes, sir. Yeah, please do.
Some trainers advise not to indulge in too much of cardio by doing hypertrophy training. Do they cancel out each hypertrophy and intense cardio?
Yeah, so first we need to remember that heart is also a muscle. So when you're considered very much about do not want to lose muscle at any case, we cannot forget the fact that we need to train our heart at all times. So we are constantly hearing about the fact that a lot of people get a heart attack and they pass away, a cardiac arrest, is because most of the times their heart is poorly trained. So let's keep that as an important thing. Let's not forget that. But moving on, we need to characterize lifting and cardio. So when it comes to lifting, there is high force and there is high fatigue involved. It makes you stronger and quite a bit healthier. It grows and retains muscle, which is very important for us at any age. And it's also, but it only burns a decent amount of calories, even if you go very hard at the gym. Okay, because you're not impacting your body too much, right? When you go for a run, you're extremely exhausted. But when you go for a weight training session, there is not a lot of movement involved. Okay, so you need to take into consideration the fact that calories are not burned too much. But when it comes to cardio, there is low force involved, there is moderate fatigue, makes you more endurant. Like I was talking about the fact that you're training your heart when you're doing cardio. Literally, the name itself is cardio. You're training your heart, which is important. You can go for miles or runs or things along those lines, and it makes you very much healthier. But the downside is your trainer is also worried about the fact that you will lose muscle. That's the reason as to why he was telling that don't focus too much on cardio. It's going to lead to muscle mass. It burns a lot of calories even when you're going pretty hard. Stimulus to fatigue ratio is pretty high. So what we are supposed to do is, like most of us are generally just trying to get healthier and trying to put on muscle mass. So you need to have a combination of both. So when you first enter the gym, right, you have to take into consideration that I want to put on muscle mass. So what are you going to prioritize first? You have to prioritize weight training. Okay. So what I'm saying is don't start off with anything that is cardio intensive, like going for a jog or for a run or getting on the elliptical or doing some kind of cycling, because your glycogen levels are going to get depleted. Okay. And then after depleting the glycogen levels, if you go to weight training, you're not going to be able to push that much weight that you possibly could have if you did not engage in cardio. So that's the reason why you're supposed to get into weightlifting first. So weightlifting, the way we're going to progress is, like I told, progressive overload. That is either increasing the amount of weight that you're doing on any particular exercise. For example, if you're doing a bench press, if you're starting off at like 40 kilos and doing 5 repetitions or 6 repetitions, you try to do 60 kilos the next week or 2 weeks or even 1 month later with 6 reps or 7 reps again. So you progressively increased in some way, shape, or form. Or else you can do through form, getting into better form, learning what proper form may be. That is also considered to be some sort of improvement. And then you can increase the amount of reps or the amount of sets. So that is how we are going to do, and focus on compound lifts such as squats, bench press, and deadlifts. These are great ways to build muscle in some shape or form. And finally, if you have to do some type of intensive cardio, keep it to weekly, 2 or 3 times at max. Don't do them every single day. Like I told, engage in some sort of elliptical trainer. You would have seen those advertisements, Orbitec Elite or things along those lines. Engage in elliptical trainers or NEAT, non-exercise activity thermogenesis. Go on walks as much as you can. Increase your activity.
நீ என்ன இது என்ன வந்து நான் உனக்கு கொடுக்காம வச்சுக்கிறேன்.
Yeah. So that would be have a mix of both.
That's good. Is there a earlier those days we used to do some circuit training with low weight and quick succession doing that?
Yeah. Okay, sir. So circuit training is, you are all busy individuals. You have a lot of patients to tend to. You have a lot of consultations to take up on. So how much will you be able to be at the gym is a realistic question that is posed by anyone who has a busy lifestyle, not just doctors. So circuit training allows you to complete a quick workout in possibly 25 minutes or 30 minutes. You just go in there and you complete all the muscle groups. It's a combination of both cardio as well as resistance training. You're not giving any breaks. When you go into a traditional weightlifting session, you do an exercise, You wait for 1 minute or 30 seconds, you take your heart rate to its base level, then you're again primed, you're ready to go for the next set. But when it comes to circuit training, you don't give yourself an opportunity to rest and prepare for the next set again. You finish one exercise and go for the next without any breaks. So you're just basically doing everything at a much faster rate than you're usually used to. But you are not going to gain a lot of muscle mass because, like we told, cardio is not going to help you with a lot of hypertrophy. So if you're doing circuit training, what I suggest is try to limit it as much as possible. Possibly, once a week or twice a week is something I would say is a push. Keep it once a week when you want to get a workout, but it's taking a lot of time. Keep your circuit at that time. But otherwise, stick to traditional weightlifting where you're taking ample amount of rest for you to prepare yourself for the next set.
Thank you. Thank you, Mr. Santosh. That's a elaborate detailing. And next question is to Dr. Raja Ekavaram. Dr. Raja, do we really need to avoid white stuff like sugar, salt, rice, and all that? Dr. Raja?
They call it as white poison, but actually they are not white poison. Actually, what they mean is refined white sugar, refined rice, dairy, milk, salt, and maida, that is refined white flour. We should take it in moderation. If we take it in excess, as Arun said, due to the carbohydrate content. Due to the carbohydrate content. It's audible, sir?
Yes, audible,
sir. In our present meals, normal meals, we take 400 to 500 grams carbs. So this excess carb intake, which will lead to obesity, later on type 2 diabetes is on increase, cardiovascular disease. And what they mean, all these white things, they can cause inflammation in the body. So what we have to do is reduction of carbohydrates. As Arun pointed out, take appropriate protein and healthy fat. By increasing protein and fat, we can reduce the carbohydrates. Some white things, as Paul said, yogurt, this cauliflower, paneer, mushrooms, they are good. They are with the low carb. We can take that. Reduce carb intake by increasing protein and healthy fat intake is the key.
Okay.
The next
shall we go to Dr. Santosh Jacob? Dr. Santosh? Dr. Santosh.
Yes, I have a question for Dr. Arun Kumar. Can I ask?
Yeah, please.
Yes, sir. Yeah.
Arun, see, for diabetes, we advise low carb diets. How about paleo and keto for people with diabetes with multiple drugs?
Yes, sir. So basically, diabetes is a disease where the body is not able to process the glucose which is derived from carbohydrates, and the body is not able to convert it into energy, either because of two things. Either the insulin is not functioning properly, that is insulin resistance, or there is decreased secretion of insulin. So in type 2 diabetes, initially for most of the people, it starts with insulin resistance, and at some point of time, the beta cells fail. And even what we say is, when a person is diagnosed with diabetes, already there is both insulin resistance and insulin under secretion at the same time, even though the insulin levels seem to be high during initial time, but already the beta cells would have started failing by then, even in type 2 diabetes. So there are two approaches in diabetes. So one thing is either, so the main thing which contributes to the glucose is the carbohydrates that we eat. So that is fine. So we can have only two approaches. Either we have to take the carbohydrates as usual, and we have to find a way to manage the sugars. So if a person is obese, definitely we have a way to decrease the insulin resistance. So that is, we have to lose weight, number one. So any kind of weight loss, whether it is low calorie diet or intermittent fasting or a low carbohydrate paleo keto diet, any kind of weight loss is going to help reverse the insulin resistance. And along with it, if we increase the muscle mass, if we do strength training, if we do a lot of cardio, so in one thing, we increase the muscle mass, the muscles will take up all the extra sugars. And if we do good amount of cardio, even if we take some carbohydrates, the GLUT4 transporters, with the help of them, the muscles are they're going to take up the blood glucose after we eat. So that is why even we say just after each meal, just some 20 minutes of even simple walking can reduce sugars in the range of 60 to 70 milligram percentage. So that is what we say. So these are the ways to decrease the sugar levels. So by the decreasing insulin resistance. And another perspective, so these have their own limitations. But say if a person is lean, if the person is say just some 75 kg and he is already 175 centimeter and he is already a normal weight or a lean diabetic. In this case, there is, except maybe from a little bit physical activity and increasing muscle mass, there is not much of possibility for him to reduce any weight or reversing insulin resistance. So here reversing insulin resistance is out of context for this kind of guy. So and where it actually contribute, so almost 30 to 40% of diabetics are in this category. In this category, the only way to reduce the glucose levels is to reduce the glycemic load. So we speak more of glycemic index, but is actually what we should concentrate is we have to concentrate more on reducing the glycemic load. That is the actual carbohydrate load that we take. So whether we are taking as a low glycemic index millets or high glycemic index rice, ultimately the total quantity of carbohydrates is what that is going to translate. So definitely a low carbohydrate diet or a keto or paleo is a wonderful option. So I've been advising, we have been myself, Dr. Raja Gabram sir, we have been advising like a low carbohydrate diets like pioneered by Mr. Neander Selvan from almost 2014 and 2015. And we have had wonderful, we are seeing people like seeing for the past 7 to 8 years, initial HbA1c of 13, who are on strict low carbohydrate diet. Even for the past 7 to 8 years, they are maintaining HbA1c less than 6 without any medications, with normal renal function, normal liver function excellently, from HbA1c of 13 to even less than 6. So there are lots of people, even my own clients from our group, lots of people are there. Only problem is that compliance. So when we say a diet devoid of all the rice, roti, chapati, millets, everything, at some point of time, so at least some 70 to 80% of the people are not able to follow the diet. So what we have realized the same, even though there will always be some ideal solutions, the ideal solution may not be feasible for everyone. So we can say get up at 4 a.m. and do this workout, but it may not be feasible for everyone. So in that case, whatever it is possible to reduce the carbohydrate load, that can be done. So if a person can, instead of taking a carbohydrate breakfast, if he can take a healthy fat or protein-based breakfast, it is fine. So it is definitely going to reduce sugar level to some extent. Or he can just, in all the 3 meals, he can take carbohydrate, but just at least reduce the load by half. If he usually takes 4 chapati or 4 rotis, he can just take 2 chapati and add some 2 eggs. Or 2 dosa, or with 1 cup of sundala chana, or some sprouted moong dal, or some 2 chapati with 100 grams of paneer or a cup of mushroom. So if you can just reduce the carbohydrate quantity into half or whatever quantity he wants, even that is going to do wonders in reducing his sugar levels. So it is not something of a magic. So now we are seeing diabetic reversal programs. And even I'm seeing doctors entering all these diabetic reversal program. They are charging something like 50,000, 1 lakh. They are giving some sensors which cost some 3,000, 4,000 rupees, and they are charging 50,000 a month for diabetes reversal. And a lot of this technology people have entered into the this diabetes management with all these fancy words and all that apps, applications and all that. But it's very simple. It is all about managing the carbohydrate intake. So either if you are obese, lose weight, build some muscles, do some good cardio workout. If you are not obese, yeah, just at least reduce carbohydrates. And even if you are obese, if you lose weight by reducing the carbohydrates, it is going to be a double bonanza. So any form of carbohydrate restriction is going to help. You need not be on a strict keto or strict paleo. Any form of carbohydrate restriction is going to do wonders. There is no doubt about it, sir. Thank you.
Thank you.
Thank you.
Can I add one more question to Dr. Santosh Jacob?
Yes.
How do you advise exercise to people with physical limitation like heart disease, arthritis, respiratory issues, etc.?
Okay. So see, that becomes extremely personal. So when it is, see, especially when they come to doctors, either when they are coming to doctors, it is only because, trust me, the gyms have told them, "Engalukku theriyadu, we don't know, go ask a doctor." So there is actually something which they definitely require expertise in. So unless you have some understanding of exercise, I would advise these 5 principles to follow. First thing, always ask them to do a check of their vitals 7 days in a row. That shows a lot of things. I have actually found this to be more efficient than anything. Second thing, ask them how many times they eat out. That is another indication of general inflammation in a person. Third thing is family history of cardiac disease. Oh, you should ask these questions are extremely important. Now, make sure you ask if they had severe COVID or not. That is another important factor. And the last thing is, if they are on night duty. If these 5 things are there, I think you should ask them to do a proper general health checkup, see a cardiologist, make sure that we have reduced all the risks of a cardiac event, then start. Okay, now that this is over, for functional restrictions, always remember, if you're, see, everybody talks about weight, right? I tell all my patients, let's talk about something which is in our control, that is our strength. If we are focusing on our strength, right, and we are only exercising on maintaining or increasing our strength, trust me, the stress is not there. The guilt is not there, because your goal is to increase your strength, not lose your weight. What happens over time is just that you're able to do and increase your strength on a regular basis. It can take 1 year, 2 years, or 3 years. So we have this anterior mid-cingulate cortex that apparently increases in size as we get more disciplined. Automatically, we start to eat lesser. Dieting also becomes easier. So all the changes, anybody who has issues, remember to take at least 18 months to get your body used to any form of exercise which changes you metabolically. Yeah, so I'm done with that answer.
Thank you, sir. One more question is, how do we prioritize our movement during, see, most of us are very sedentary, and how to make it a routine into a life?
Just pay attention for the next 5 minutes. I will share you my entire protocol, which I advise all my patients right away. So there are 6 things, okay, strategies to improve your movement. First thing is, set up regular reminders. It's very, very important. Smartphone apps are okay. okay, your calendar is okay. Make sure that you set up the prompt to 1 hour. Next thing, micro breaks. Okay, the concept of micro breaks are very important. What is it? It's a song you like. Put on the song, walk. It's a micro break. You can work during that time, but make sure that you take that micro break. The third thing is focus. What are the things in your environment which you can really use? If you have steps, use your steps. If you have a walking pathway, use it. Anything you can to increase, to get up, to walk, do it. Third thing, walking meetings. If you're on the phone, don't sit, stand up and walk. There is no reason why we should sit and talk on the phone, right? Because we are not doing any work, nor are we talking to anybody. We can walk. The next thing is, I really haven't done it, but a lot of my colleagues say standing desks are extremely useful, apparently, because we walk around a lot. And the last thing is, what has really helped me and my patients is get off 1 kilometer before your house and walk. Okay, these are the strategies. Now, what are the exercises which I advise all my patients who are starting off? Upper body, desk push-ups are fantastic. Okay, all of us have a desk. No, go to the desk, do push-ups. 5 push-ups every 5 patients is more than enough. Okay, you will easily do 50 push-ups. Next thing is chair dips. Sit on the chair, go up and down. Do it on a regular basis. Third thing is arm circles. This is also extremely important. Then for your lower body, squats. Simply keep your arms in front, get up, go down. Tighten your core. After that, calf raises. Lift up your ankles, tighten the soleus and the gastrocnemius, leave it down. Lift up your legs and rotate your feet, swinging your legs. This will improve your circulation. Core and back. Sit up in the chair, tighten your core. Feel your core. Tighten your obliques, the other obliques. Do it on a regular basis for 10 seconds. Stand up. Do your side bends. Whenever you do it, feel the muscle. Finally, sit on the chair, do your twists. All these are simple exercises all of us can easily do. Make a pattern, learn the exercises, do it. Finally, extremely important, set up your system in such a way that it doesn't stress your neck. Neck exercises are extremely important. Simple exercises, opposite side, stretches in the front and in the back. Make sure you always do a slow range of motion. Don't do the fast one, katak motak, right? There is nothing good in it. Do a slow, controlled range of motion of the neck. Shoulder shrugs are extremely important. Tighten your shoulders. Leave it down. Finally, deep breathing exercises. This you can do sitting. If you're just able to incorporate, see, desk push-ups, chair dips, arm circles, squats, calf raises, leg swings, abdominal tightening, side bends, chair twists, neck, finally, forearm stretches. If you're able to do all these exercises throughout the day, trust me, your mobility will be saved. If your mobility is okay, all you need to do is have an exercise routine, strengthen your muscle. Muscle can be manipulated. Do this and you're good.
Thank you. Thank you, Dr. Santosh. The other question is to Dr. Raja Ekambaram. Dr. Raja, what are your thoughts on nutritional supplements? Like people taking calcium after menopause, or with so many options available, which one do we really need? Dr. Raja?
Yes, sir. It is again 750 billion industry. If you open up Amazon or anything, lot of things. A to Z, everything supplements they advise, and it gives good attraction to patients. So everybody when they come to our clinic, they ask what supplement to take. The ideal supplements are not the replacement of nutrient-dense healthy diet. First thing, supplements can only supplement eating a well-rounded healthy diet. It can give you additional support. I mean, many people think only taking supplements is enough. They are not focusing on the healthy diet. Supplements never be used in the place of real food. Never underestimate a nutrient-packed food to a pill produced in the factory. Vitamins and minerals are more essential to your body to develop and function well. Most people get all of what recommended by eating healthy food, what they eat. Others need little extra nutrient boost. Not only the supplement for everything. The supplements, we can classify it as useful, doubtful, not useful. Useful are like folate, iron, B12 for vegetarians. This doubtful are many of us takes omega-3, this vitamin D. If it is very deficient, to some extent, vitamin D is 2 months or 3 months is okay. Some people take continuously take vitamin D, end up in hypervitaminosis D.
Yeah.
If vitamin D is adequate, whatever calcium we take in food is enough. Body will absorb. If vitamin D is low, body will not absorb the calcium we take in the diet.
Right. Okay. Thank you. Probably the last question in this session, because we are running out of time, to Dr. Arun. Dr. Arun, can you just advise us on post-bariatric? Being a surgeon, I'm asking you post-bariatric dietary advice for malabsorptive procedure and restrictive procedure, if you can. Thank you.
Yes, sir. So it is all about whether it is a malabsorptive procedure or a restrictive procedure. So most of the bariatric surgery patients lose weight because of either the from the restrictive surgeries, they lose weight because of the portion control. So they're not able to eat the quantity of the items as they were taking before the bariatric surgery. So that is one thing. And in the malabsorptive procedures, so the nutrient absorption also gets cutting down. All this interplay between all these hormones and the gut peptides, and these play an additional role. But what we could see is even after bariatric surgeries, depending on the type of procedures, there are lots of patients with rebound weight gain. So some procedures have a higher chance of rebound weight gain, and some procedures have a lesser chance. So for some procedures, even the rebound weight gain goes even up to 50 or 60%. That too more for, I think, for the restrictive procedures, the people have more of a rebound weight gain. And for the malabsorptive procedures, they have a lesser rebound weight gain, but they have other micronutrient issues. They have issues with the absorption of the nutrients. So what even after the bariatric surgery, so ultimately what I would repeatedly tell is that ultimately we can do any sort of intervention, but the only intervention that is going to help us is dietary control. So even after post-bariatric surgery, even a person who has underwent a restrictive type of surgery, he will, I have seen people from 140 kg, they have gone down to 100 kg, and they have again gone back to 130 kg. Because after the reduction in the in a restrictive procedure, after reduction in the size of their stomach and all this stuff, they start to eat lesser nutrient dense frequent food. So they have learned to overcome their whatever we intended to reduce, they are trying to overcome it. So that is what they are trying to do. So even after that, so what I would say is definitely we have to cut down on the carbohydrates, and they have to consolidate on their meal frequency. So definitely they can't increase the meal frequency. They can't just keep on taking small quantity frequently. Definitely it is not going to do good for them. So maximum I would say is three meal, not much of snacks, or 2 meals and one snack for them. So even if the content, the quantity they can hold is less, let it be like that. And definitely they have to cut down on carbohydrate. They have to increase more on the proteins and fiber. In case of restrictive procedure, in case of malabsorptive procedures, there we are seeing lots of micronutrient deficiencies, particularly B12 and all that. So in such case, definitely, I think we have to focus on all the micronutrients, vegetables, and all that. But they can take additional supplements also if the situation warrants. So definitely less carbs, more protein, and consolidating the meals, as I said in the first slide, definitely is going to help in the post-bariatric surgery patients also. Yes, sir.
Thank you. Thank you very much, Sharon. With this, I think we can conclude because we're running short of time. I hand over this to our CGP secretary, Dr. Sendil.
Thank you, sir. We all had a wonderful session, and almost it is 3 hours from 6, and still a lot of questions to be answered.
Pending,
and
yes.
There are a lot of questions from the audience, and we sincerely apologize for those unanswered questions, but we will definitely make it possible in the next session. And we have planned to conduct more such programs in future, specifically and totally targeting general public as a separate session. So there was also some language problems. We will definitely sort out in the next programs. Thank you, sir. And now I request our Secretary CGP Headquarters, Dr. Anburajan sir, to deliver vote of thanks.
So really we had a very good feast for our knowledge, and the theme, what we have selected, my health, my right, was really, this day, we had a lot of new terminologies, new developments, new things that we have to know. And as it is a participation from the public also, definitely it might have brought a lot of knowledge into them. And all those who are attending here are those who are having social concern and having mind to create social awareness among the people. So right people have been reached. As right people have reached this message, this message has been reached to the right people, definitely it has been taken to the community in a right way. That's why we want to appreciate the Tamil Nadu CGP wing, that such a wonderful program was being organized by them in this World Health Day. I have to thank our Dean, Dr. Satyajit Bora sir, for being with us, encouraging us. And it is his thought that we are having this day observation and encouraging all the way, and being done his welcome address and gave a very good introductory talk also. I thank Dr. Diravya Mohan and Dr. Ananda Chokkalingam for joint secretaries in National and IMA CGP Tamil Nadu for their part in this. Though our president was not able to come, National president was not able to attend, our senior vice president, Dr. Gunasegaran sir, was here with us, encouraging with his very enthusiastic president's address. And though our national HAG was not able to attend, our financial secretary, Dr. Sijit Bali sir, was with us to bless us in this task. And as usual, Professor Dr. Jailal was giving his very wonderful, elaborate keynote address, giving the full sense of the concept of my health, my right, and what is our part in that also. So as per his request, IMA CGP, as it is a professional body, a wing of IMA headquarters, and also having branches in all the states, will definitely influence the government to proclaim the right right to health policy for the public. I have to thank Dr. Abul Hasan sir, President of IMA TNSP, for his acceptance to do this, observation and make it possible, and also for his wonderful words of felicitation. And as usual, Dr. Arbraj was very authoritatively, he was telling what we have to do through IMA CGP for the coming days. And I am thankful for his wonderful words. And Dr. S. Karthik Brewer, Honorary Secretary, TNSP, is also of, very thought-provoking in his address and felicitation. And from play to performance, the intersection on nutrition and fitness. Both the moderators and panelists have done their level best. We cannot, we are not having any words to say them any thanks. And Dr. Shinasamy sir, Dr. Hariharan sir, Dr. Saravanan sir, and Dr. Raja Yagambaram sir. They have been of much, sensational in asking questions and making the topic to be elaborated according to the needs of the audience here today in this forum. And I have to thank Dr. Palaniappan sir, the gastroenterologist and nutrition specialist, and Dr. Arun Kumar, the pediatrician and nutrition specialist, and Dr. Santosh Jacob, orthopedic surgeon and sports medicine specialist, and Dr. Santosh and Mr. Santosh Prem Kumar, the fitness coach. Everybody was very crisp and telling us a lot to learn from their words. Especially, I have to thank Dr. Palaniappan sir, because he's joining us in a far distant place and very enthusiastically, addressing all our questions in a very interesting way. And all the panelists were very, thought-provocative. They are having a good experience and knowledge, and then authoritative in that concerned field in which they are being asked to talk with. And really very interesting. And as Dr. Sendil Kumar told, there are a lot of questions might have been unanswered, but in the days to come will be definitely make this kind of programs for the benefit of the public in the future. We'll be doing it. And I have to thank the Tamil Nadu CGP team, Dr. Sendil Kumar, the chairman, and Ananda Chukalingam, the secretary, and other joint secretaries, and all who have been very effectively done this, and a lot of advertisements have been done very effectively. And really, it's a great time we had, sir. Once again, we thank the moderators and panelists for their enthusiastic participation and very effective deliberations for the public. And I think more than 500 doctors were online, and more number might have been come through the YouTube live link also. A great opportunity for IMA CGP headquarters to both address the doctors as well as the people who are directly having their influence on the public and influence on the government in taking policies to bring a very interesting and beautiful narrations on my right, my health, my right. Thank you very much. Thank you one and all for all this who have come and participate.
Thank you, sir. Thank you very much.
Thank you, sir.
Thank you.
And just we request our secretary, sir, to say a few words about the
yes
world.
As such, through IMA CGP headquarters, we are conducting a educational tour. So for the enriching of our intellectual as well as regeneration of our physical So a lot of things we have been heard about our physical fitness. And one way of regenerating our physical fitness is seeing different places of interest and enjoy the nature and get benefit out of it. In the meantime, we want to make it as a intellectual enriching opportunity also. So from 3rd May to 11th May, we are planning for an international education tour to Sri Lanka on the occasion of the international Sri Lanka during the South Asian Regional Conference of World Organizations of Family Doctors. WONCA is having its South Asia Region Conference in Colombo during 3rd, 4th, and 5th. So making this an opportunity for our doctors, we are arranging this very interesting, international study tour. So the amount is very, nominal only. So 3 nights and 4 days, it's only 35,000 for single occupancy and double occupancy 30,000.
And the brain
evolving
brain evolving template, no evidence of hypertense MCA sign.
So no, whoever want to join this can contact us, IMA CGP, either
no evidence of hypertense thrombus to suggest
Tamil Nadu wing or IMA CGP headquarters. So the brochure will be sent to you all and you can follow this. It's very well explained. So for those who are willing to join only for the 3 days of the conference, also we are making a package that will also be announced to you. Kindly follow this and then be a part of it and get enriched intellectually and also regenerated physically. God bless you all.
Yeah. Thank you, sir. So thank you all our panelists and moderators, sir. Yes, sir. Sarwan sir, thank you, sir.
Thank you very much.
Yes,
thanks for the opportunity. It is a great
sir, thank you.
honor.
Raja sir,
thank you.
Thank you, sir. Santosh Jacob sir, Prem sir.
Thank you, everybody.
Sir, thank you, sir. Yes, sir. We'll catch up soon, sir. Yes,
yes,
sir.
yes, absolutely.
Yes.
Thank you.
Yes.
And public also should be announced that we will come back to your
yes,
questions.
Sir. Yes, sir. Definitely. We will
later on.
Yes, sir.
Thank you.
Thank you, sir. Thanks.
Video.